Pleasure to welcome you to the public lecture organized as part of the celebration of our 20th anniversary. My name is Sholari, and I have the privilege of being your host this morning. We sincerely apologize for starting a bit late. We'll try as much as possible to get on with the program immediately, and we hope to have a good time together. To begin, I would like to specially recognize and invite the members of the High Table. First, we're expecting the First Lady of Lagos State, who would be with us shortly. We would also like to welcome the chairperson of the event this morning, Dr. Josephine Awosika. Please to the High Table, man. Dr. Josephine Awosika is the chairman Access Bank, former chair Access Bank. She's also the honorary consul of the Czech Republic. She's served she served on many boards, and currently at various times served as the permanent secretary in the Federal Ministries of Internal Affairs, Science and Technology, and Power. She's also a fellow of the Pharmaceutical Society of Nigeria and the West African Postgraduate College of Pharmacy. She holds a doctorate degree in pharmaceutical technology from the University of Bradford, United Kingdom, and she's the chairman of Charms PLC and Josephine Consulting Limited, and also a non-executive director of Capital Express Assurance. Please once again help welcome the chairman, Dr. Awosika. We'd also like to welcome the guest speaker, Dr. Modupe Elebute Odunsi. Welcome, and please to the High Table. Also present, and we would like to welcome to the High Table is Mrs. Adekpetun Temilola. She's the founder and MD, Skilled Integrated Services Limited, and she currently serves on the board of SS Dental Clinic. Ma'am, please welcome. I'm also delighted to welcome to the High Table Dr. Yinka Leshi. Dr. Yinka Leshi currently is the Chief Clinical Director of SS Dental Clinic. Welcome, sir. Also, I'll be inviting Mrs. Oladejo Modinat, the Chief Operating Officer and the Chief Host of the event today. Ma'am, welcome. I would especially like to recognize all the dignitaries that we have here present, the esteemed ladies and gentlemen. We have the MD of Access Bank here, ably represented by Ms. Bolariwa Anima Shaun, the Regional Sales Director. We have, thank you. We have representatives of different organizations that are here with us. I would especially also like to thank the media team for working closely with us. You're welcome. And most important to our patients. For those of you that are here, thank you so much for being a part of our story. Thank you so much for being a part of our journey. And thank you for joining us here today. Next on the agenda is the opening prayer. We would like to welcome Pastor Gabriel Adibowale to say a few words of prayer for us, please.
Shall we recognize the presence of God, the Alpha and the Omega, the beginning and the end? As we agree together to call upon His name, is the source of inspirations and wisdom for the service of mankind. The Alpha and the Omega, the beginning and the end. The one who created man in his own image and after his likeness will reference your authority and dominion. One who has given this planet heart unto man to dominate, to rule over, to subdue, to replenish, to flourish, to be fruitful. You have made all things well. And when enemy came, Lord, you redeem man back to yourself, and you impart wisdom to help one another. We thank you because as the water covered the sea, so is the wisdom to make this heart habitable to mankind. I want to thank you for the inspiration given unto mankind as you have gathered your people today, because you said you want to do something new, so that we be able to make this heart better than we met it. Lord, I ask, even through this avenue, SS Dental Clinic, Lord of Heaven, you will give solution to the problem of mankind. In the name of Jesus, Lord, from this meeting, because you are a faithful God, impart knowledge, wisdom, and understanding to address this menace common among men, in the precious name of the Lord Jesus. Lord, we ask that your mighty hand will rest upon men in this place to grant understanding, to be able to help mankind better, to care. Lord of heaven, grant this understanding in the name of Jesus. Wisdom is profitable to direct. Lord, impart wisdom in the name of Jesus Christ. This is the burden in my heart, O Lord, that God, that we open our heaven and pour inspiration unto man so that we'll be able to tackle this problem that is common among men. Oh Lord, especially this issue of cancer. How it's ravaging human realm. I've been praying in the secret. Many patients that we have, even in the church, that are having these challenges. God, I ask, this lecture today, you will grant unto us a higher realm of authority to the wisdom that comes from you alone. In the name of Jesus. Thank you, everlasting Father. I know you will do something great. Lord of heaven, a man of knowledge increases strength. Impart into every one of us to make us to become agents of change in the name of Jesus. We want you to take absolute and full control of this lecture so that we go into the world and to begin to shine the star and the light unto as many who are in darkness in the name of Jesus Christ. You are the Lord that healeth us. We have that the inspiration for healing will come upon SS Dental Clinic so that they will be able to see things that we are yet to see, things that look obscure, so that solution will come unto the illness among men in the name of Jesus. This is our sincere heart, O Lord. Give wisdom, give understanding, raise giants in our midst that we use as solution in the name of Jesus. Blessed be your name, our Father. We give you all the glory and praise. In Jesus' name we pray. Before I leave this place, I want us to recognize that as we are here, someone is not here physically. The founder of this foundation, Dr. Yabo Sofolue Sadari. I want us to just observe 1 minute silence. The Lord has taken her home and is resting with the Lord. May Jesus so continue to rest in perfect peace with the Lord.
Thank you very much, Pastor Gabriel Adeboale. For us to progress now, before I call on Mrs. Oladejo, who is the chief host of the event this morning, to formally welcome us to the program, I would like to recognize the presence of Mrs. Folashade Adefisayo, the former Commissioner of Education, Lagos State. You're very welcome, ma'am. Also, our very own Mr. Clinton Peters. Welcome, sir. I also have the honor of welcoming Dr. Karoui and Dr. Karoui. Welcome, sir. Welcome, ma'am. Also here with us is Miss Bolaji Shadari. You're welcome. All right, now, I would like to please welcome, invite Ms. Oladejo to give us her remarks, to formally welcome us to the event.
Good morning, and welcome to you, our distinguished ladies and gentlemen. It is indeed a special privilege to have you all here, and it's also a privilege for me to stand before you all as we celebrate 20th anniversary of SS Dental Clinic Limited, the brainchild of Dr. Iyabode Shofolu Shadari. Dr. Shadari founded SS Dental in 2003 with a vision to provide world-class dental care to Nigerians in Nigeria without discrimination based on socioeconomic status or any other bias. This was a cause she stayed true to till the very end. Our being gathered here 20 years later is a testament to the success of that vision. Throughout the time I worked with Dr. Shadari, she ensured that we all worked not just to offer a comforting dental care to our patients, but to also show love to everyone around us. She was always a happy person. And in that process, you wouldn't have a choice than to give your very best to everyone around you. And she's the type that will always get up to even offer coffee to the smallest baby, if need be. She always said our patients are kings, and no one on the team was too important to serve the patients. We carry on our legacy today through our corporate social responsibility projects to underserved communities and our frequent oral awareness sessions at companies, schools, churches, and the like. The theme of this lecture was strategically chosen because we believe it is one she would have wanted. And we thank Dr. Elebuti Odunsi for accepting to be here with us today to share your wealth of knowledge and expertise. Thank you, ma'am. After she got diagnosed with cancer in 2016, she volunteered with organizations and raised awareness about cancer. She lived what she preached, and she continued to maintain a positive outlook until the very end. Being here today, you join us in honoring her and celebrating her life's work. Our esteemed patients, you are the reason we exist and will continue to work hard. Thank you for constantly trusting us to maintain your oral health. We're especially grateful to everyone here for making time to be here and on time despite your busy schedules. After the different presentations, we will have the opportunity to engage with the different speakers. Please take note of your questions, and we are sure they will be willing to answer them. We look forward to an interactive session, an educative session as well. Welcome, and please enjoy. Thank you.
Thank you very much, Mrs. Oladejo. Now, I know earlier I made an attempt at properly introducing the chairman of the occasion today. If I were to score myself, I did below average. I apologize. So back in school when we failed, we had opportunity to do a resit. So I would beg your indulgence, please, to allow me do a resit to reintroduce the chairman of the occasion today. Am I allowed, please? Thank you very much. The chairman is Dr. Josephine Awosika. Dr. Josephine, thank you. Dr. Josephine served as the immediate past chair on the Access Bank board. She also, while with Access Bank, she joined in 2013, and as an independent non-executive director, she served as the chairman and vice chairman of the Board Credit Finance Committee and Audit Committee. She's an accomplished administrator with over 3 decades experience in public sector governance. At various times, she served as the permanent secretary in the Federal Ministries of Internal Affairs, Science and Technology, and Power. She is a fellow of the Pharmaceutical Society of Nigeria and the West African Postgraduate College of Pharmacy. She holds a doctorate degree in pharmaceutical technology from the University of Bradford. She also served as the former chair of CHAMS PLC and Josephine Consulting Limited and a non-executive director of Capital Express Assurance. She is a member of numerous associations and committees. Also, she currently is the honorary consul of the Czech Republic in Nigeria. Please, ladies and gentlemen, help me welcome the chairman, Dr. Josephine Awosika.
You indeed did excellently well. Good morning, everyone. I say everyone because I believe we're here in one spirit, celebrating one person, our late sister, whose works has followed her and allowed us to be here, to come together for a good cause, beyond whom we are as individuals, but what we stand for, identifying with what she stood for, that is still speaking today. It's very rare in Nigeria that works of people continue to speak after them 20 years in good stead. I thank everyone that is here this morning, and I welcome you for this good cause. Most especially, I want to thank the team headed by our sister Modinat Yetunde Oladejo, the CEO. They caught the vision, and they kept the vision growing. A great example for everyone, not just in Nigeria, but globally. It's rare. So going now officially, as is always expected, distinguished ladies and gentlemen, I want to begin by welcoming you again to a special event, celebrating our late sister and SS Dental 20 years after. the SS Dental Clinic have been able to pull this up with an inner strength that is beyond mere words. So they pulled stakeholders together, and we are seeing here today a very momentous occasion, starting with the prayer of the pastor that was so moving, so convincing that God is here with us, and God is smiling at us. And the saint that we celebrate is also happy that we are celebrating 20 years SS Dental Clinic after her departure. It is truly an honor for me, and I use the word truly. I like to choose my words very seriously, to be here, to participate in the 20th anniversary public lecture series, and to be honored to chair the occasion. It's an honor. I thank you, and I salute you greatly. I would like, therefore, to express my appreciation to a few people here, Mr. Clinton, and to all the invitees for sparing time on a Tuesday morning from your very tight schedules. And I mean tight. Lagos schedules are tight. To honor late Dr. Iyabo Shadari Shofoluwe, the founder of this clinic, as was earlier referred to, in the year 2003. She must be young. Late Dr. Iyabo Shadari, I didn't know in person for Shofoluwe, but I read, and I heard witnesses speaking about the phenomenal dentist that she was, combined with her passion, they told me, her vision and dedication to create a remarkable dental practice that continues to transform lives and improve oral health awareness in Nigeria. And that word, oral dental awareness, is very poor in Nigeria, I must say. It's very, very poor. And I always imagine why. Because everything goes through the mouth, both disease and good things. But yet, oral care is not taken as it ought to be. But I want to believe that, like I told COO in private, that I hope that we'll start with our children at a very young level. That's where I was started with oral health. At my nursery, oral health was taught to us very seriously. And I know when we line up for what do you call it, like before you start assembly, they inspect our teeth. Have you brushed your teeth? And so everyone who has not is ready for disgrace. They put them in one place. But that has gone. Needs to come back. Because that's the little I know about oral health, connectivity, and health, state of health, is so important that it's done. And I will keep awareness on this up. There is no doubt that the contributions of Iyabo have left an indelible mark on the field of dentistry and serve as an inspiration to aspiring dentists and indeed all healthcare professionals. Because healthcare professional is about serving humanity. It's more than money. It cannot be bought. It cannot be completely paid for. But it can make life better for the individual giving the service and those receiving the service. Since 2003, SS Dental Clinic has consistently demonstrated an unwavering dedication to delivering high quality and dental services to patients of all ages. Their state-of-art facility, you will say, how did I know? My daughter-in-law uses your place, and her description is incredible. And she has drawn everybody in the family to the place. So it's a first-hand testimony. Irrespective of, let me get my line back, please. Thank you. Boast of cutting-edge equipment ensures precise diagnosis, and that is so key, and effective treatments. The clinic's team comprised of skilled dentists, hygienists, support staff, not only exhibit proficiency in their respective roles, but also possess a deep sense of compassion, fostering a welcoming and comfortable environment for every patient, quote and unquote, from her. Let me use this occasion to commend the staff and management for keeping up the international standards, which I call WHO standards, set by late Dr. Iyabo. Years after her death, is still going on, is still moving on, is still taking place. God bless her soul. God bless her family. God bless the team that have become SS Dental team for moving the work forward. I want to deviate a bit here. When HIV/AIDS started, I was still in military hospital, Yaba. And my greatest fear was the handling of dental patients without taking care about whether HIV transmission is going that way. And we have a very harmonious team at the military hospital, Yaba. We don't differentiate professionals. We come together. And I raised the fear one day that I have this silent fear that we should begin to watch carefully and give the best attention to those that come for dental so that they are not transfused indirectly or directly with HIV/AIDS. By the way, because you have an open interaction with blood vessels close to the head. The head of dental screamed and was now developed a protocol for ensuring that. Thank God he did. Thank God he did. There was a day they wanted to give transfusion to an SS, not SS and this patient that wants to have a major dental intervention. And they brought the blood from the lab. Said, did you check the blood for HIV? He said, yes. Okay, I need a cross-check again. It was positive. We have a responsibility. We have a mandate from God to take care of the human beings that he made, as Pastor said, in his image and his likeness. Perhaps health professionals will just begin to see that God has just placed me in charge of life. And that makes the difference. More than money. Money is good. Money is important. It will come. But responsibility and action is so key. And I want to believe that that's what Iyabo believed in. Not the money she was getting at that time. Not the fame or anything. But the service. And that service has brought us here 20 years after to talk about how great a vision, a purpose, a calling, the might, the strength, the belief, the comradeship, and the unity of strength has brought to SS Clinic. Thus, we are celebrating 20 years. And we will celebrate more years in that same strength and improvement. So we have gathered here today because of our shared understanding and willingness to think more about how to achieve a cancer-free body through various lifestyles that help to prevent cancer. As we all know, the burden of cancer is quite enormous and resource-consuming. And cancer of the mouth is incredible, terrible to watch or to see. And I'm sure we'll hear from the experts. Therefore, preventing cancer is not negotiable, must be done. Today's event should be seen as another step towards achieving that goal looking at the credentials of the guest speaker and knowing her work as well. The ladies are winning. I want the men to stand up. Challenge. I have no doubts in my mind that she will do justice to it today. She will underscore everything that we want to know about preventing cancer, managing cancer, and how to live hygienic lifestyle. By the time we end the lecture series, we will have come up with a communique that will map out clearly how to live a cancer-free life. What a great resource SS Dental is bringing to humanity. Without any doubt, I believe strongly that this public lecture series, among other initiatives by SS Dental Clinic, has come to stay. Humanity needs you and what you are giving. And it will go a long way. You may not see it today. It's just like when a stone is thrown into the river and it starts trembling, reverberating. It can turn into a great wave that will help the ship to move. We want to sail using your contacts today as you come in with a great lecture from the experts. And we believe that clearly SS Dental is well positioned to further contribute their quota to building a healthy and wealthy nation, but also will help to lead a change in the lifestyle of a cancer-menaced society, not just in Nigeria, but globally. Let's take our word from here across the world, through Africa. Let's keep our people with the knowledge. As the pastor said, knowledge is strength. Let's receive the strength and hold one another as we pull on to get a better tomorrow. God bless you.
Thank you very much, ma'am, for your speech. I paid close attention while you delivered that, and I appreciate all the words that you have just said. While I appreciate that, I also picked on the fact that you mentioned that a close relative has been to the practice and made recommendations, and I said quite a lot. But I would like that to be humor. I would like that to be humor. So I take this opportunity to please invite you to the practice, to have a tour of the facility yourself, and also experience the SS Dental effect. Once again, thank you very much, ma'am. I want to appreciate the presence of Dr. Adeyinka. Dr. Adeyinka is an orthodontist at the practice. She's one of our consultants. Welcome, ma'am. I also would like to appreciate Dr. Aziz Fashino, Dr. Fash, like we like to call him. He's the maxillofacial surgeon at the practice. Welcome, sir. I would like to also recognize the presence of Dr. Graham. Dr. Graham is not here with us in person, but he's tied in on Zoom. He's joined virtually. Thank you for tying in, sir, and welcome. Now, Dr. Graham has sent us a message. Dr. Graham is also a member of the board of directors at the practice, and he's his family. He's got a few words for us. We would like to please listen.
I would like to welcome you all to this 20th anniversary lecture in commemoration of 20th anniversary of SS Dental Clinic. My gratitude to Her Excellency, Dr. Mrs. Sanwo-Olu, for gracing us with her presence on this occasion. I would also like to thank Dr. Awoshika, who is chairing this occasion for us today. I would like to thank Dr. Elebute Odunsi, who is our guest speaker for today. I would also like to thank all the staff of SS Dental Clinic, the board of SS Dental Clinic, and Also, a very, very special thank you to Mr. Clinton Peters, who has been immensely helpful in helping us organize everything today. It is with gratitude that Iyabo's memory is being maintained and that the clinic is continuing to grow and flourish. Thank you very much, and I hope you have an excellent lecture. Thank you.
Once again, Dr. Graham. It's been 20 years of having the brand SS Dental around. Many of us who work at SS Dental enjoy the environment, we enjoy the culture, we enjoy actually being a part of something important. Now, we have some of our senior colleagues that, you know, yes, by virtue of the term, we can call them colleagues, but in reality, we cannot call them colleagues because they are the leaders. They are the ones that we follow. We would also be welcoming one of them to tell us the history, give us an insight into where the practice is coming from, how it has been, and where we're going. Now, I will be inviting Dr. Leshi, Dr. Yinka Leshi to deliver this. Now, before I do that, I would like also to introduce him, and I do not intend to fail this time. Now, I'm shivering already because it is indeed a privilege to be talking about important people like this. Dr. Leshi is the Chief Medical Director at SS Dental. He's a consultant oral and maxillofacial surgeon. He's a fellow of the Royal College of Surgeons in Ireland. He's also a member of the British Association of Oral and Maxillofacial Surgeons. He's a member of the Association of Dental Implantologists of the United Kingdom. He's a member of the Society for Advancement of Anesthesia in Dentistry. He's a member of the Nigerian Dental Association. He's a member of the Association of Private Dentists in Nigeria. And he's been in practice for over 35 years. So this is why I say he's not a colleague. He's a leader. Sir, welcome. Please, a round of applause for him.
Thank you very much, Damilola. As we are all gathered here today, we are gathered here just because of one person and the vision that person had. And my role here is very simple compared to the major lecture we're going to get in a few minutes. But I'd like to just take you through the journey which we started with SS Dental and where we hope to be in the future. So SS Dental Clinic started its journey on the 1st of July 2003, founded by Dr. Iyabo Shofolue Shadare. Having started her work life as a dentist at the Federal Medical Center before moving to Echo Hospital, her passion for dentistry and the need for provision of quality private dental care gave birth to SS Dental Clinic on the 1st of July 2003. It started in a couple of rooms within a medical establishment, that's the Q-Life Clinic on Bishop Aboyade Cole, Victoria Island. However, it soon became apparent as patient flow increased, the need for a bigger floor plan. This led to a move to Dream Plaza, just across the road from Q-Life Clinic in 2005. There she occupied half of the third floor. In this phase of the clinic's growth, in keeping with the vision of Dr. Iyabo Shofolue Shadare to provide holistic dentistry, various dental specialties were introduced, notably orthodontics, periodontics, oral and maxillofacial surgery, and prosthodontics. Dr. Iyabo Shofolue Shadare herself was a pediodontist, that is a child dental health specialist. She started with 2 dental chairs, but soon had to add a 3rd chair in 2011. To accommodate the various specialties that gave service at SS Dental Clinic. Again, it became obvious that our square footage had to increase. With the demand for high-end dentistry from our patients came the need to meet expectations with the latest in dental technology and high-end equipment. We were one of the few clinics at that time to offer implant dentistry to our patients. Also treatment of anxious patients under intravenous conscious sedation. And this obviously helped patient satisfaction. In 2017, the bold step was made to move to our current site at number 4B Wole Olateju Crescent, Lekki Phase 1. A long lease was secured on the building, and it was purposefully renovated into a 6-chair multi-specialty dental clinic with state-of-the-art equipment. Sadly, in January of 2021, a visionary leader and founder, Dr. Iyabo Osofolu Eshadare, went to be with the Lord. But it was her desire to have a branch of the clinic in Ibadan. And in keeping with this, SS Dental Clinic was opened in Ibadan in July 2022. It has been an exciting journey over the past 20 years, providing quality dental care for the Nigerian populace. No doubt we have had challenges along the way, but I must say we have always come off stronger and better. At this point, I would like to thank the wonderful and dedicated staff of SS Dental Clinic, who are seated at the back, for making this journey such a wonderful experience. We are committed to striving harder in providing excellent dental service to meet the needs and demands of an ever-increasingly knowledgeable and demanding dental public. We are eternally grateful to all our patients that have stood by us over the past 20 years, and we promise to continue to provide quality dentistry to meet all your expectations. I believe dentistry is one of those professions where it's evolving on a daily basis, you know, and to be able to provide this quality service that we're talking about, it is important we evolve with it, you know. And I must say, at SS Dental, we are committed to continuing to evolve with dentistry as we bring better care to all our patients. Thank you very much. Yeah.
Thank you very much, sir, for giving us a brief history of the practice. Now we would like to move on very quickly to the topic, the major reason why we're here, the lecture. We would like to listen to the lecture, and I would like to invite the guest speaker. However, before I do that, I'd also like to take my test. I'd like to introduce Dr. Modupe Elebute. Dr. Elebute, after qualifying from the College of Medicine, University of Lagos in 1986, completed a postgraduate training in internal medicine and hemato-oncology at Centers of Excellence in London, including St. Bartholomew's Hospital, St. George's Hospital, and the Royal Marsden. She received a prestigious fellowship from the Leukemia Research Fund and gained a Doctor of Medicine degree from the University of London for her groundbreaking work. In the UK, Dr. Elebute has held consultant and honorary senior lecturer posts at St. George's Hospital, the National Blood Service, and King's College Hospital. She has a well-established private practice at the Spur and Leicester Hospitals. In Nigeria, she has worked at the Lagoon Hospitals, where she was instrumental in developing a pathology laboratory and a sickle cell clinic. Dr. Elebute is widely published in scientific journals and textbooks. Passionate about giving back, she helped set up the Sickle Cell Club of Lagos while still at medical school. She's patron of Build Africa and a past trustee of the Walkabout Foundation. This morning, she's also our guest speaker. Please, ladies and gentlemen, apologies, please. I'll take that line again. Dr. Elebute is widely published in scientific journals and textbooks. She's passionate about giving back. She's helped set up the Sickle Cell Club of Lagos while still at medical school. And she's patron of the Build Africa and a past trustee of the Walkabout Foundation. And this morning, she's our guest speaker. Please, ladies and gentlemen, help welcome Dr. Modupe Elebute.
Thank you very much. Excellently done. Thank you. However, I think all that stopped about 3 years ago because I'm now back in Lagos after about 35 years or so because Yinka and I were classmates in medical school. I did medicine, he did dentistry. So back in Lagos, running the Marcel Ruth Cancer Center and Specialist Hospital just around the corner. That's what I'm doing now. So good morning to everybody. Good morning, ladies and gentlemen. I feel extremely, extremely privileged to be here. It's been a really hectic few weeks, and when Mr. Clinton came to the hospital to ask me to do this, I really didn't know how I could fit it into my life, having promised my children, who I have sort of abandoned for about a year, that I was going to come and spend some time with them. But I'm grateful that I managed to be here today. But I really appreciate the invitation and the amount of work that is taken to put all this together. So I want to also start by just saying a huge thank you to our chairman of today. What a sort of real brilliant setting for everything that we're hopefully going to do this morning. And to Dr. Leshi as well for updating us on the history of the dental clinic, and to all the staff who've been involved in putting this together. Before I actually start my lecture, I wanted to make a few comments, because when I was asked to do this, I remember Graham Shofolue from staff school. I think he was maybe 3 years, 1 year senior. So Yinka and I go back a long, long way from primary school, when we were about 5 or 6 from University of Lagos Staff School. And I remember Graham. I don't remember Iyabo that well. I remember her name, but I don't remember her personally that well. But I should do, because I've got my seniors in the back of the room, Dr. Mrs. Karonwi, who I know are all, her classmates as well. But I did get a call just as we started Marcel Ruth, when I opened Marcel Ruth in 2020. So I think it was a few weeks, maybe a few months after we started, when I had a phone call about Dr. Shofolue Shadare being unwell and had been having her treatment in the UK. But she had decided that she wanted to come back to Lagos, and would I please be involved in her care? And I didn't actually remember that until you just gave that story about the history, brought it back to me. And I remember actually speaking to her on the phone. And the reason for saying this now, to her blessed memory, is that most of the call was about the fact that she wanted to come back because she wanted to set up this clinic in Ibadan. And I still remember on the other side of the phone thinking to myself, you're clearly very unwell with advanced cancer, but you sound very passionate and very committed to wanting to come and set up a clinic in Ibadan. So, but I mean, I think for me, it was like unbelievable. I just didn't know who this lady was. And subsequently, we actually had about 2 telephone conversations. Unfortunately, she didn't make it back before she went to be with her maker. But it just made me think. I have to say a huge thank you to the staff of SS Dental and to the board, because I don't think I've ever come across a situation, I know we say in Nigeria, but even outside Nigeria, where a new beginning has occurred after the founder of a business has passed on. And for that, I really want to commend all of you this morning. And to say thank you. And then for somebody who has spent the last 7-8 years before I am now in Marcel Ruth, I'm thinking to myself, well, I hope when I'm gone, people will still be doing something after I've left. I mean, honestly, it is incredible. So well done and thank you. Yes. So I think, I was given this topic, and to be honest, I didn't really think too much about it until yesterday night when I sat down and I thought, I'm cancer-free body. So is that a question or is that a statement, right? So am I supposed to stand here and say that, I'm going to encourage all of you to live your lives in a way that you're going to have a cancer-free body? Or am I going to turn this into a bit of a schools debate? I don't know, put up your hands, those of you, when I was at Queen's College, it was one of my things, school, debating society, where, the other people will come up and say, no, we are actually going to speak to the opposition of the topic. So I'm not actually going to turn it totally to the opposition, because I don't think Mr. Clinton will be very happy that he, persuaded me to come and give this talk. But I do want to say that I hope that at the end of the lecture, you will understand that a number of things are within our control. And that's the message that I really want you to take away with you today. But clearly, in this condition, as well as other silent killers, some of it is out with our control. So that's I think, is it possible to switch the lights down or off? Not so that people can fall asleep, but I think otherwise, perfect. That's just fantastic. So for those of you who haven't been to Marcel Ruth, and because I haven't been to SS Dental, I won't be cross today. But this is what the hospital looks like at night with very nice lighting. We're literally round the corner of Bishop Oluwole. I in particular, and my husband, are extremely grateful to God that this journey that has brought us back to Lagos has actually become operational, and that in just under 3 years, we've seen about almost 3,000 patients on that site. And I wanted to set the scene, not about it being our success, but about the reason why I think SS Dental chose this topic. This is a condition that is not something that you don't find easily. This is not something that's diminishing, and certainly I think the chairman already alluded to it. It's something that we really need to pay attention now to how we are going to hopefully impact the numbers that we're seeing, and also the impact of the condition to both the patients and their families across the country. So one of the things I wanted to set the scene with is that that's what the normal body looks like from top to toe. And obviously the team at SS Dental typically are dealing with the top of the body. But that cancer can affect every single bit of us anywhere, which is something I think most of us tend to forget. And in particular, even with myself coming to set up Marcel Ruth, the amount of head and neck cancers or conditions that I've seen, I've never actually come across before. And so that importance about oral hygiene or education and awareness, as part of our education and awareness, I have to say that until today, I probably have not done too well on that bit of it. And it's something that we need to all think about. It does affect everywhere in the body. And cancer, yes, is probably the biggest silent killer, if you want to call it silent killer, because most of the patients that we see are walking around doing and running their busy lives and so on, when suddenly they might end up in hospital with what they think is actually not a very big issue, a small lump in the breast, a bit of diarrhea, constipation, things that actually, happen anyway, normally, and actually when they go to hospital, they may end up not having any problems whatsoever. But for some, they end up with this huge news saying, actually, this is cancer. And the change that brings into their lives, not just for them, but also for their family members, can be huge, as we are speaking in the memory of Dr. Iyabo Shofolo Shadari this morning. But also I wanted to make the point that there are other silent killers that we should not forget about. And one of the ones that I feel that is on the increase in Nigeria, although I probably don't have the statistics, is cardiac issues. Certainly post-COVID, the number of particularly men who have had heart attacks, quite a few sudden deaths post-COVID and so on. So obviously the theme today is about cancer, but I think what I'm trying to say is that our general health and well-being is something that we need to really pay attention to, because it could be a problem. I think I missed a slide. Yes. So what is cancer? And of course, I'm speaking to mostly healthcare professionals, but I know that there are also patients and relatives in the audience. And this here is what cells look like on the top of whatever lining they're on. So it could be any part of the body. This could be the lining of the mouth, oral cavity, and the cells that form the layers beneath it. It could be the breast, it could be the prostate, it could be in the gut. Essentially what happens is that these normal cells that are sitting pretty on top of one another, and it's incredible the way God designed the human body, because apart from the fact that he gave us two of everything, apart from your heart, okay, which means that, God forbid, if you lose the vision in one eye, you can still see, and so on and so forth. I mean, just the thought about that. But everything is done in such an ordered way. And even when we lose normal cells, the body has a way of bringing them back on a day-to-day basis, whether it's your hair, your nails. It is quite incredible. But in cancer, what happens is that nicely divided, nicely top and tailed design that you see gets altered, because whatever is driving the division of cells becomes abnormal. In plain terms, that's what it is all about. So normal cell division becomes disrupted for a particular reason, and I'll explain that in a few more slides. Most of the time, if those cells just stayed where they were, so for example, if you had a lady with breast cancer and you have this lump and it just stayed there, it doesn't actually cause the devastating end of the journey, of life's journey. What causes the problem is when these cells break through this lining or this membrane and actually either go into nearby structures like lymph nodes, and then those cells get carried around by the blood around the body, and then into far organs away from where they started in the first place, so that breast cancer could cause problems in the lungs, in the liver, and indeed in the brain, for example. And that's what the issue is. And the reason for saying that is that if you don't take anything else away from this lecture today, cancer is a journey. And if we can pick up the cancers early, and we can treat them before they move either through this membrane or to other distant parts of the body, we will win that battle. We win that battle every day. We also lose it every day, and in particular, in our part of the world, we're losing more than we're winning, because the majority of the patients that we see are presenting when it has already spread. So the message this morning, and I think also it's a very important message, because when I came back, I realized that once that word cancer is mentioned, it's a hugely negative term. It means that's it, nothing's going to happen, death is certain, and so on, to both the patient and the relatives, and that is not true. So if anybody's having that discussion with you another day, you heard it from somebody who has spent more than 30 years of her life in this field. The fact that a patient has cancer or develops cancer does not mean it's the end of their journey. But obviously, it can be a problem, but in particular if they present late. And that's the message. So why does that orderly normal cell division, which you see here, which is governed by genes, genetics, so I'm sure a lot of you still remember your biology, and even if you don't remember anything else, I'm sure you remember DNA, right? Ladders. So the DNA in the normal cells, causing cells to divide and be nicely ordered, becomes disrupted. Something goes wrong. And typically, it's a combination of two things. It's usually some internal genetic problem that has, and it doesn't mean, genetic doesn't mean you're born with it. You can also have acquired mutations or acquired abnormal genes that occur at that time and stops the cells from dividing normally. Either on its own, a genetic change on its own, or a genetic change together with the external issues that we can sometimes do something about. So for example, smoking tobacco, the longer you smoke for, the more likely you are going to end up with lung cancer. And I, when I was working at King's College, had the privilege of working with a very, very sharp consultant radiologist who was trialing 4D images, not 3D, but 4D images, looking at the lungs, looking at blood vessels in patients who smoke. And in case nobody ever told you before, the effects of tobacco is about 20 times worse in women than it is in men. So if a young girl starts smoking at age 20 at the same time as a young man who smokes from age 20, the likelihood of the woman getting cancer is higher. It's about 20 times higher than the man, for whatever reason. The other thing is if the man stops smoking, and typically they say in the guidelines that if you stop smoking, your lungs can go back to normal within about 5 years. With a woman, it takes about 10 years to come back to normal. So the point of that is that these external things that can cause problems, also the effect is different in the different sexes, is different in the different people. So some people will say, oh yes, but my brother smoked for 50 years and he never had lung cancer. Well, that's just the way the body is. Someone else will smoke for 5 years and end up with lung cancer. Some people don't smoke at all and end up with lung cancer, as I'll illustrate to you in a minute. So internal genetic factors, together or on their own with external problems, UV light, tobacco, aflatoxins, which is a contaminant of food. And since I've been back, I understand actually in melon seeds, egusi seeds, when they're dried, if they're not dried well before they're put into plastic containers, you know how people sometimes buy them, right? You can have some mold on the egusi, right? It's aflatoxins are part of what is in that mold. So food that's not well dried, well preserved, well, kept, those are the kind of problems. Arsenic can be a contaminant in water and asbestos in the air, in particular where the building hasn't been done properly. And then, of course, we have issues with infections, and in particular in our environment, in the lower to medium socioeconomic areas in the world, we have a significant number of cancers that are driven by viruses, and I think this was alluded to earlier on. So we see quite a number of HIV-related cancers, lymphomas in my world, but also oral cancers, genital cancers, cervical cancers, and so on. So the message there is that unless we do the test and check whether the patient is HIV positive, even if we're treating the patient with all the chemotherapy and so on, we're not going to get rid of that cancer. But also the awareness about cancers has to go hand in hand with all the external factors that could cause the problem. So for those of us who are, I'm going to be 60 next year. I have a serious problem with the fact that I'm going to be 60 next year. So if I say it again and again, just bear with me. I know. I think I have less of a problem with the fact that I'm a grandma, than the fact that I'm going to be 60. I don't know why. But for all of us in that sort of, this issue with cancer, with the other silent killers, the cardiac problems and so on, increase dramatically with age. So if I go back to what I said at the beginning, being given a talk about a cancer-free body, there is no way you're going to make yourself a cancer-free body unless you are not, you're not going to get to 60, 65, 70, 75, and so on. And clearly, I'm sure we all hope we will be because, life, 40 is the new, 60 is the new 20, 25? Yes, right? Okay. Yeah, help me here. Just help me, right? So, age is an issue. Age is an issue. The older we get, the more likely we are. So that you cannot remove this risk altogether. So, although I'm saying it in jest, I don't mean it in jest. And the reason for making that point is that when you get to age, I think 40, really, every birthday, you owe yourself a health check-up. An annual health check. I'm sure that when you listen to the rest of the lecture, you'll understand that this is an important, non-negotiable, non-whatever issue. As sure as it's your birthday is how sure you have to be about the fact that you're having that MOT from top to bottom and beyond to make sure that everything, that you know your numbers. I think that's what Mrs. Ogoyemi and I, who's our director of nursing at Marcel Ruth, say to our patients, you need to know your numbers. You need to know your blood pressure. You need to know what your fasting blood sugar is. You need to know what your fasting lipids are. And of course, later on, you need to check yourself, your breasts, examine yourself. You have to have your pap smear, and so on, because with age, you're not going to run away from this potential issue. But of course, if you anything starts to become abnormal and is picked up early, then as I said, the likelihood of it not becoming a problem is higher. Okay, so what are the symptoms? I've told you what cancer is. The normal division goes off, combination of genes and external factors. How does somebody know whether they have cancer? So this, I think, gives all the different ways that cancers can present. So a mass or a swelling anywhere in the body that remains there, because of course you can have an infection that presents as a boil or whatever it is. But if you have a lump or a swelling that does not go away after a few weeks, then you certainly should have it checked out, all right? So the swelling of the mass, abnormal bleeding, and abnormal bleeding could be anything. Bleeding that doesn't normally occur, whether it's in the mouth, when you're brushing your teeth and suddenly your gums are bleeding. That could be dental hygiene, but if it persists, it needs to be looked at. This reminds me of a patient who presented not too long ago, who is, I think, 85 or 86, who went to the bank to collect her is it PTA, your money that you want to travel with. And she said, to her horror, she was standing there trying to get the thing, and somebody was like, oh, ma, there's a pool of blood where you're standing. So she moves to the side because, obviously she's been menopausal for 40-something years or whatever. And then she realized that she's moving to the side, the blood is moving with her. So she's absolutely fit and well. She was about to travel to England the next day. So this is what I'm saying about silent killers. To cut a long story short, she has endometrial cancer. But that's how she presented, standing in the bank with a pool of blood, suddenly bleeding as though she was having periods. The change in the skin color anywhere, again, anything that persists, and obviously in breast cancer, nipple discharge together with a lump, any wound. Most people will say, oh, I thought it was just a wound. I think we've seen about 4 or 5 patients with really, really bad sarcomas, tumors of the muscle and the skin. And they will always tell you, some of them, they've had it for 15, 20 years. I still don't understand. I'm telling you, they remember when it started, but they just thought it was a wound. And 20 years later, it's now become a serious problem. Unexplained weight loss, and unexplained means unexplained, not when you're reducing your diet and so on, that persists. A cough, or you're coughing up blood, and then we're back to the swelling of the mass. So those are the sort of things that should, anything that you're worried about, and I always say, it's important, and we're all very busy. That's always, and that's, it's not because we're neglecting ourselves, but most of the time it's because we're very busy. But the older you get, and then when you see these abnormal things, always please, at least check with somebody. And I don't mean check with Google. I don't mean check with Dr. Google. And even if you ask Dr. Google once, it's fine. But, don't please come to the clinic and say, and then I checked on Google, and then 2 weeks later I read something else, and then said, no. There are doctors in the house, right? Okay. So treatment options for cancer are listed here, and it's just to say that the point I'm trying to make is that for the majority of our patients, they need a combination of treatments. Because people always think that, it's just surgery, or it's just chemotherapy, or it's just radiotherapy. But in fact, for the majority of cancers, we need a combination of all three. So breast cancer patients will need chemotherapy sometimes to make the lump go smaller before they have the surgery to remove the breast. And then afterwards, they may need some more chemotherapy, and then they'll need radiotherapy. And the message here is that this is not a short-term injection. The majority of our patients end up needing treatment for months and months, sometimes for almost a year, as I'm sure that the family of Dr. Iyabo Shofolo Shadari probably experienced. So again, the moral of the story is, prevention is definitely better than cure. Why should we be worried? How common is this problem? Is it really, people are not sure, keep asking me, is it that there's an increase in the number of cancers in Nigeria now? Why do we have all these people with cancers? I don't know. I can't answer the question. One thing I will tell you is that there is a paucity of data, and I'm sure that's the same for almost everything that we are doing in this part of the world. We have no data. And sometimes I feel for my husband and I, when we came to planning to set up Marcel Ruth, we were going everywhere trying to find out, were we actually going to have patients coming into the building? Because we didn't know how many cancer patients were around. And although there are about 4 cancer registries across Nigeria, you can't get data from any of them. So we have an issue with data. And it's one of the things we're beginning to address. But if you look at it worldwide, where there is data, very well-defined data, particularly by an arm of WHO that does nothing else, the Globocon arm of WHO does nothing else but put the data together. In 2020, when all of us in this room, we had one thing on our minds, just COVID. Okay? COVID was it. I don't know about you. For me, at one point for the first time in my life, I was really afraid. Thinking, are we going to see this through? Are we going to be alive? Or is the world actually ending here? Sort of thoughts. When we were worried about COVID in that 2020, 3 million people died worldwide from COVID. 10 million died from cancer. That's the sort of level in terms of cancer all over the world. Commonest in women, breasts. Commonest in men, prostate. In our part of the world, we don't see lung cancers as much as is seen in parts of the world, and that's where there's huge public health driving people stopping smoking. I don't know how anybody can smoke. I never did, but anyway, But now when I see the packets of cigarettes, do you see packets of cigarettes where they have photographs of the lungs on the packets that you're about to buy so you can light this thing up? And it says, smoking kills, right? And yet, some people still think it's okay to smoke. But that's a different, obviously it's one of my things, right? But yeah, but cancer, huge issue in terms of numbers compared to even COVID that we were worried about. I'm struggling with this thing. So Nigeria data, you'll have to take this with a pinch of salt, like we had to take it with a pinch of salt, because certainly in a population of 200 million people, it's difficult to believe that the total number of cancer cases that were registered in 2018 was only about 100,000. Okay, we have an issue in this part of the world in collecting data, and it's something we really have to change, both from healthcare initiatives, but also from the financial aspects of our world. But anyway, breast cancer, commonest like the rest of the world, prostate in men, colorectal for both. And you can see here, there's nothing about lung cancer, for example. So that's why it's important that we have data, because what is happening on our side of the world is definitely different from what's happening in other parts of the world. So just going back to health now, and I think I've sort of said some of this already, what determines our health? What determines me saying I'm healthy? Because I know my numbers. I don't know how many people are going to put up their hands here. Who knows their blood pressure, fasting blood sugar, fasting lipids? And, no, Dr. Green, I mean, do you know or don't you know, right? Those of you who are not putting your hands up, next week I'm going to come back to find you, and you're going to put up your hands. Just next week. I don't mind where you go, all right? It's important, okay? So we've talked about genetics, talked about environmental factors, and then, of course, most importantly, because that's what we all think about, our lifestyle choices. I've already talked about my issue with smoking, okay? Fine. So genetics, totally out of our control, right? One of the commonest genetic problems in our part of the world, or even mostly in the world, is sickle cell. Something that was actually the reason why I ended up going into hematology in the first place. I was in my 4th year in medical school when I did a short, I think it was a 2-week stint with Professor Akinyoju and Professor Mrs. Akishete. And it was the looking down the microscope and seeing these cells, these sickle cells, and looking up, and then you said, well, so that's the diagnosis, sickle cell. And I was thinking, oh my gosh, just by looking down the microscope, we can say what's wrong with somebody that looks normal in front of you, and so on. And that's the reason why I went into hematology. Until tomorrow, it's still what I know. Most of the time on the ward round, I'm dragging everybody down to the lab to go and look at blood films. And they're like, honestly, you know. But the fact that you can look down the microscope, make a diagnosis, go into the room next door, tell the patient what they have, and then be able to manage them, for me, is probably one of the greatest gifts that medicine could have given the world. So obviously, and you know, some of this genetic, because again, the message here, people think, oh, genetic condition, that means that there's something abnormal, that means that it's bad, and so on. But I don't know how many of you realize that the sickle cell, the gene for the sickle cell, actually stayed on because it was a way of Mother Earth, if you want to, protecting us from malaria. Okay? So the people who had the gene, who were carriers of the gene, the S, so they had A and S, were more likely to survive malaria than those who were AA, right? And that's why in malarious regions, and there's a whole research behind all this to do with the mosquito and so on, and I'm not going to bore you with it, but take it from me, that's why the S gene survived, to help people survive these malarious areas. And if you look at the parts of the world where we have sickle cell, it's in very heavily malaria-driven areas. So it occurred or passed through generations to actually protect people. That's why that gene remained. So it's not all genes. I mean, obviously, when you have both the genes together and you have the combined SS or SC, then you can have the problems that sickle cell patients have. But in genetics in itself was for a reason. And of course, there are a whole load of genetic problems, and like I said, we don't have control over many of it. I mean, some people will stand up and argue the point that, well, if you know you're AS, you shouldn't marry somebody who is AS, and so on. I have to put up my hand and say that even though I've been doing this for 40 years, I'm not exactly sure how you tell somebody who has met their life partner, right? And those of us who are married know that marriage is not an easy journey, but it's better if you're with somebody who is your life partner, and how you decide in an unemotional way that actually I can't be with you because of this gene. And of course, thankfully, we now have ways of testing babies before they're born and so on. But the point I'm trying to make is, some of these things we have to live with and hopefully live around. I'm struggling with this, I don't know. Where am I supposed to point it? Okay. So that's genetic factors. And I said sometimes on their own, they cause problems, or sometimes together with environmental factors. And there's a list here, and I'm only going to pick on the things that I think are important in this area. So now some of this I don't have data for, but one of the things that we've seen at Marcel Ruth, I think we've seen 4 or 5 women with lung cancer who have never smoked before in their lives, and who don't live with smokers either, because you're supposed to also have the risk of passive smoking for lung cancer. But I've seen 4 women with really, and obviously, being back, know a few other ladies who have had lung cancer. So I have a theory about generators, but I don't have data, right? So that's what I'm talking about, the environmental issues. The cars, here we don't live in the developed world where now cars that are emitting smoke cannot be on the road, right? I mean, even if you don't move to electric whatevers, they will, they have ways of measuring them, and they don't sell cars like that anymore. And certainly actually one of the families that had a patient who died from lung cancer, I went to visit. I think Kemi and we went together actually. And somebody else in the family also had lung cancer, both women. Okay? And I just said what I said now. I said, well, the thing is, I have an issue, a theory about generators, when the relative said, oh, hang on, actually, we have had a problem in this house. When we built this house, our next door neighbor's generator pipe comes out beside our bedroom window. And the other lady who now had lung cancer was a relative who used to come and stay with them regularly from Ibadan. So, like I said, I don't have exact data, but what are the chances of 2 women in the family having lung cancer when they didn't smoke or live with anybody who smokes? I'm not saying go and switch off all your generators, but I maybe will be saying go and check where the pipe is from your generator and from your next door neighbor's generator. The other thing is public health campaigns and prompt access to good health service is one of the determining factors. So it doesn't matter how much fruit and vegetable you and I eat to make sure our BMIs are, weights are not high, and we don't smoke, and we don't do this, and we don't do that. Because remember, there's the genetic factor. So if for any reason you still end up in a situation where you get cancer or a heart attack or anything else, one of the things that determines whether you can have a healthy body or a healthy life after that is how quickly you can access health care. And I'm sure you don't have to discuss with more than 5 people in this room, whether on the dental, medical, pharmaceutical side, the massive issues in this country at the moment, and I'm sure in most of Africa, where honestly, just for the fact that they could have access to care yesterday, do you understand? Just for the fact that they could pay for their medication, just for the fact that they could have radiotherapy, they might still be alive today. So it's one of the determinants of our health. And of course, there's our lifestyle, which I've talked about, maintaining a healthy weight, I don't know about the gym. I think that one, the people in the gym sector basically held us over a barrel for years. They were just laughing. They were really laughing. Because hands up, how many of you had gym memberships but never went? Yes? Okay. How much money? In fact, after a while, you don't even want to calculate how much you were paying because you can't face it. It was coming out. And they take it monthly. So whether they see you or they don't see you, they will take your money monthly. But the other thing is, how many of us did all this exercise, but when we sat down at night and ate our pounded yam and efo and everything, the weight was going up, right? So the message today is actually, it's the diet that matters. Even those who don't go anywhere near a gym, if you actually watch what you eat, that's, so I'm not saying cancel your gym membership, but pounded yam at night is not going to help. All right? Okay. And then post-COVID, I think the mental health issues that we now have to also be aware of, and of course in our world, is something that we are constantly thinking about because we have a responsibility, as I always say to my team, not just to our patients, but to their family, to support them through that journey with the person that they're coming with. And sometimes family members behave so badly, like so badly, you don't even want to know. And you have to always remember that, it's sometimes just a reaction. The patient themselves might have come to terms with the diagnosis. Dr. Shofoluwa Eshadare is talking to me on the phone about setting up a clinic in Ibadan, when I'm sure the rest of her family and support around her were like, oh my gosh, the world has ended, right? So, but we have to remember that that is also quite an important matter. Okay, so I'm sure most of you have seen this, and I think I've spoken, the message I was trying to talk about was the exercise and the food, and really and truly, it's about the food. But the other big thing, and there's been a lot of research on this now, is about sleep. A lot. And I've read a lot about it, and I don't know why, because I still am not really sleeping much. But sleep is apparently very important. So if you're to be able to keep your weight down, to be able to benefit from the exercise and watching your diet, you do need to have a minimum recommended number of hours of sleep. And those who really follow this, so my now almost 32-year-old daughter, went through this whole thing about preparing yourself for sleep and making sure that she went to bed at 10 o'clock every day and so on. And she swears that that's when her weight started to come down. That's when she was coping better at work and so on and so forth. So I think it sounds as if there is something in this story. I don't know why it keeps jumping. I'm so sorry. Okay. So risk factors, we talked about genetic factors together with the environmental factors and then the lifestyle issues. Genetics. So who is that on the left-hand side? All the ladies in the house? You see? He wanted audience participation. There you go, right? Angelina Jolie, okay, who decided, and it depends on who you're having this conversation with. Some people will say, she must be mad. How can she? Why would she? Electively, as in nothing is wrong with her, and she's had both her breasts removed, I think in 2013. And then subsequently, actually, she's also had her uterus removed and her ovaries and fallopian tubes. Because she tested positive for a gene called, we call it the BRCA gene, the breast cancer gene. There are two, 1 and 2, so BRCA1, BRCA2, BRCA1 or BRCA2. BRCA1 seems to be the one that gives a higher risk of breast cancer, whereas BRCA2 is more linked with ovarian cancer. But the gene or no gene, she also has a very significant family history of cancer. So her mother died from ovarian cancer, but her grandmother and her aunt also died from breast cancer. So because we can't easily do things like the BRCA gene, because we don't have labs that can easily do these tests, so you have to sort of think through what is practical. So anybody who presents with cancer at a young age, or anyone who has a significant family history of cancer, just assume there must be some genetic factor, all right? And I'm going to just also say that one of the things that we found here at Marcel Ruth, and I'll show you the data in a minute, is that for some reason, and I don't think it's just because it's the kind of patients who are coming to see us or anything like that, because we see patients from a wide range across the country, we seem in this country to have a higher association of family histories of cancer than I've ever seen before in my career. So one of the things we've started doing at Marcel Ruth is collecting blood and saliva samples from patients and storing them in a freezer. And we're going to be working with the genetics group in a few months' time to start looking at the genetics of our patients. Because there's a serious, and the interesting thing is that the patients also know. So when you say, do you have a family history of cancer? Because you will assume that, oh, I'm in Lagos, I'm in Nigeria, or the patient who has come from the east or from the north, but they know. Because I always draw a family tree. The resident medical officers that work with me think, they think I'm OCD. I probably am. But I draw a family tree for every single patient that I see, all right? And I've sat there and I've drawn where the family members have told me, there was a young man who was 20 from the north with colorectal cancer. We're seeing quite a lot of young patients with colon cancer, young patients with breast cancer. When you ask them, my father died of prostate cancer, my mother died of this, my grandma died of that. But they know. They actually know the history. So positive family history is important. And where you can, doing these tests for these genes will help let you know what is going on. Apart from genes and the environmental and lifestyle problems, in our part of the world, in Africa, we also have this issue with infections driving that disruption, do you remember, of those orderly dividing cells. So just the fact that these infections are going on, particularly viruses, some bacteria, they're listed here. So Helicobacter pylori, for example, because we have a lot of patients. I'm sure some of it is to do with the spicy foods that we eat, but we have a lot of patients who have a lot of dyspepsia, gastro-reflux. And I'm always surprised how little they know about H. pylori or have had a test. Helicobacter pylori is a bacteria that was found about 20 years or so, initially in the Japanese population, but we also have as high as an incidence in Africa of H. pylori. And the issue with H. pylori is it infects the household. So it's not a bacteria that's going to make anybody unwell at all, in fact. And some people have it from childhood, which I think is why we have such a high population of colon GI cancers from the north. Because apparently in the north, they have this, where the families live together, in the same house, not even just in the same compound or so, like maybe in the west or whatever, they live together. And I've seen quite a few northern patients who are H. pylori positive. Now, by giving the patient some omeprazole and antibiotics for 2 or 3 months, you can totally clear this bacteria, right? But if you don't think about it, you don't test for it, and it stays in the body for a long time and disrupts that orderly cell division for a long time, it puts these patients at risk of getting both stomach cancer and colon cancer. And like I said, it's quite important because we're seeing quite a lot of young patients now with these cancers. HIV, I've talked about already, and of course everybody knows that the hepatitis viruses can lead to liver cancer. So genetics, environmental, now we have infections in our part of the world. We have a lot of problems, right? We have a lot of problems, okay? But we can reduce some of the long-term outcomes of these issues, the genetics, the environmental, the lifestyle, the infection, if we have it and we don't even know, by having our health checks done, annual health checks, because when you have them done, when you're being asked about what's going on or you're being examined, the doctor is going to say, oh, but this your gastric thing has been going on for too long. Maybe you should have an endoscopy. Or actually, there's a H. pylori test, which is just a breath test, and so on. But if you know, so it's really important that you have these checks done so that it can tell you earlier if there's anything going on. Like I said, quite a number of issues when it comes to, yes, now we pick up a patient with cancer. How are they managed? Not just cancer, blood pressure patients. I mean, I remember seeing a patient in my clinic who was so delighted that he met me, and I was thinking, okay. He said, but you're Dr. Elebute. Oh my gosh, you're Dr. Elebute. I said, yes. He goes, your mother was the one who diagnosed my blood pressure 25, 30 years ago, and I'm now seeing you. If it wasn't for your mother, I will not be here. The doctors I've seen abroad in India and everything, they told me that by now I would be having kidney transplant because your mother made sure that I came to her blood pressure clinic every single month. If I didn't go, they would chase me, right? And that's what we need to do. That's what we need to do. I mean, in the NHS now, if you don't turn up for your blood pressure measurements, they tell you to send it to them by text. Like, okay, you want to take it at home? Take it at home and send us the results. Okay? So we in the health profession, we're duty bound. And we now have technology. We now have texts. You know, we do. We have WhatsApp. You know, I hope there are no, is there a politician in the room? But you're retired, ma, right? You're retired, okay? Because to be honest, these sorts of things of us knowing whether our blood pressure is high and having the health should be done in the public health sector, right? The government hospitals should be running these programs. There should be blood pressure clinics. There should be, you know, diabetic and all. And we don't have them. So in the private sector, we've got to do, but we have the opportunity to use all this modern technology that our patients have to remind them to come to clinic, to tell them to send us their results if they're not going to come to clinic, and to chase them, because we have to chase them. Because what I don't want to be seen anymore is sitting on the other side of a table when another 34-year-old person comes to see me in clinic, and actually they now have gastric cancer because they had H. pylori in their family, whereas if somebody had given them omeprazole and antibiotics, we would not be here. Yeah? So we have an issue. We have problems with infrastructure. We have problems with healthcare funding. We have issues. The biggest issue, which I never thought I would be in a position to be trying to do anything about, is about education and awareness. And every single one of us in this room, we have the responsibility, I think it was alluded to earlier on, to try and make that change by telling our co-workers, school, mother, whatever, people, how important it is to actually pay attention to our health. Because when patients become unwell, sometimes it's too late because we can't offer any treatment. And even where we can, the treatment is too expensive. It's so expensive that there's nothing that they, is difficult for them to actually manage that. You don't have to read all this on the slide, only what is in the box. And the point here is about the workforce. So, I mean, when they were mentioning all the kind of doctors that work in SS Dental, I mean, I couldn't spell half of them. The periodontologists, they're this, they're that. I mean, they're so super specialist, right? Pediatric, periodont, what I'm trying to say, goodness, the training that they've had, there can't be more than 1 or 2 or 5 of them in the country, right? Okay, that's the issue we have. So in oncology too, that's the problem we have. We don't have that many specialists that are trained. At the time I made this slide, I think there were 80 registered consultant radiation oncologists in the country. And half of them had never even worked on a radiotherapy machine. Okay? All right? Now, out of that 80, probably 40 of them have left to go to the UK and Canada. And in the meantime, we haven't trained anymore. We have a problem. Radiotherapy machines. Now, you should have one of these machines per 100,000 of the population. Maths was never my strong thing because I think probably I would have gone into finance Somebody was saying about we shouldn't like money too much. Anyway. So we should have at least 1,000 of these machines, because every single cancer patient needs radiotherapy as part of most of them, as part of their treatment. They have the surgery, they have chemotherapy, they need radiotherapy too. It's not optional. When you read the guidelines about how you manage colon cancer, chemotherapy, surgery, and radiotherapy for most of these patients. But in Nigeria, we have 10 radiotherapy machines, and 2 of them are in the private sector, one at Marcel Ruth around the corner. If you look at this map, where you have these black things means that even though there's a machine there, it's not working, right? So they're working in Lagos, they're working in Abuja, and I'm not even sure, because UCH's one hasn't been working for a while, and so on and so forth. And if you look above Abuja, and I've already said about the number of patients that we're seeing from the north and the middle belt with all sorts of cancers. Okay? So, brings me to Marcel Ruth. Although, to be honest, that's not why we decided to come and set up in Marcel Ruth. But having been back in the country, it was 6 months into being back, I woke up and I said, God, you know something? I don't go to church every Sunday, but actually I should go and live in church. I should. But giving me this opportunity, this blessing, to come and be doing what we're doing here in the standards that we're trying to achieve. Thank you very much. And in the same way with a lot of you in the room, when I was listening to Dr. Oshofolua Shadari, wanted to set this up to international standards, excellent standards, and I know that the majority of the people in the room were all working to those standards, even in a tough environment. You know, it's only by the grace of God, that's for sure. But, so I've shown you the issues, and actually, as I've said, of course, the government has, you know, a big job to try and correct a lot of the issues. But we all know that when you come into public sector and public health, it takes years for you to actually even see the results of what you're doing. And you need a lot of money. I said we have 10 radiotherapy machines, we need 1,000. So can you imagine how much, if we're going to do it in the government sector, how much they have to find, and that's just the machines, talk less of the hospitals and so on. So in the private sector, both in dentistry and in medicine, I do believe that we have a role, a responsibility to try and make this change, to try and close this gap for patients. And yes, I know that we're probably too expensive, but at least we've got to do some of the things that need to be done, including providing the infrastructure, trying to help to keep this workforce here. The other day on my word round, I said, because, you know, medicine is so exciting. And you could see they're all looking at me because, frankly, they're just coming to work because they're doing their plab to fly tomorrow. So they're wondering what I'm talking about. You know what I'm trying to say? But I think that, you know, better pay, better conditions, training opportunities, and just enthusing them like we were. So apart from the fact that Yinka and I were classmates, when my father was provost of the College of Medicine, his dad was the deputy provost at the same time. That's where we come from, right? And so on and so forth. So we have that. We had that blessing. We were, you know, we went to medical school like it was nothing, and we had very reputable teachers who were so passionate across the country, actually. And the competition between UCH and Ibadan and Lagos and Nsukka and so on and so forth, you know. And actually, that was why we did well when we went abroad, let's be honest. If we didn't have these incredible teachers who were so passionate, so keen, so, you know, knowledgeable, who, I remember going to journal clubs and so on in medical school, we wouldn't be who we were. So we have a responsibility to try and close this gap. To push awareness programs, I'm sure if you haven't heard anything else from me this morning, you've heard about health checks and education and awareness. to support our patients and their relatives in the right way. And because I come from a background of doing research, which I really enjoy, I think also it's an opportunity for us now to begin to collect our own data here in Africa. So for the pharma companies, with all due respect, ma, you know, because a lot of the drugs that are being designed and are being used in this field were designed for the Caucasian population. And we know that our genetics is different. And so when I go to international meetings and they're always saying, well, you know, the African American population, breast cancer patients do poorly because, and the African whatever prostate patients don't do so well because, I'm like, yeah, because the drugs you're using are not designed for our patients. But then, of course, it comes back to us. We need to help to collect that data, and that's what we're beginning to do. So, our vision as Marcel Ruth, which sounds exactly the same as in SS Dental when Dr. Shofolo Eshadare started 20 years ago, it was exactly the same thing, to develop a system run by very qualified people to drive excellent standards of care, putting the patients at the center of everything that we do, and to be able to look after these patients at home in their own country. You should come to one of my clinics and listen to the journeys that some of these patients have had with their relatives. I remember a professor from Ogbomoso and his wife describing to me how they had spent 9 months in India. He said the room that we were in was like in boarding school, right? Because they have to go and hire, because it's foreign exchange, to pay for the accommodation. And I don't know, you might not know, so radiotherapy, when patients have only radiotherapy, and some conditions only radiotherapy, they come and they're only on the machine for about 15 or 20 minutes a day, but it goes on for 5 weeks. It's Monday to Friday for 5 weeks. So picture a patient who travels all the way to India, has to stay there for 5 or 7 weeks minimum, but every day they just go onto the machine. Well, they have to wait in queue and so on, and then on the machine for 5, 10, 15 minutes, and then they go home. That's it. But they've left their family, their friends, their colleagues, everybody, because we only have 10 machines in the country, right? So having that care, and now actually with Kemi Ogunyemi's team running a nurse-led chemotherapy, an excellent, actually, I would say, nurse-led chemotherapy system at Marcel Ruth, and doing a lot of work with our young-ish or young breast cancer patients to explain to them that, you know, cancer is a journey and you should continue with your normal lifestyle. So people will come and they expect that means they have to stop work for the next 9 months. And we're like, no, you can work. You mean I can't? No, because they said, I said, yes, it's a journey. You have to go to work, and you've got to do all the things that and we're not far from Harbour Point. We always tell them. So when you have that thing at Harbour Point, wear your dress, come have your treatment, and then go to Harbour Point. And that's what's happening now, you know. And I still remember the first patient that I tried to persuade. She was shaking like a leaf. She was an arbitration lawyer. And there was nothing I said. She stopped. She wasn't going to work because there was no way. I mean, cancer, hey, I'm fighting for my life and all the, you know. And luckily, it was early stage cancer. Anyway, so Ms. Oyemi takes her off. She's fantastic at counseling. And next thing I know, she comes to the day unit and she's having her treatment, but she's like this in the chair, you know. Is it finished? Is it finished? That's the chemotherapy. Anyway, after a few weeks, I walked in, because then when I first started the hospital, as I'm sure, I lived in the place, you know, 6 o'clock in the morning up there and midnight. On a Saturday morning, she was rushing in. I said, oh, is there a problem? She said, no. She said, you're going to laugh at me now. I said, well, hey, I've got this arbitration case in Kigali. I'm going. So matron said, if I just quickly come for my treatment, I can just go, and then I can come back. I'm like, so yes, I went back to work. Mrs. Ogunyemi, she's been fantastic. Work is fantastic. I didn't even tell anybody, because anyway, you know me, I was wearing turban before. So now my hair fell out. Nobody knows what's going on because I'm still wearing my turban. But the change the absolute change. And actually, a few weeks ago, I went somewhere and I saw her on a golf course with her husband. The same person. I mean, she was convinced this was the end, and there was nothing that you could say. But now that we have a system in place of qualified people who understand that actually this is a journey, and for those who present early in particular, we can make that change because they will survive. And whilst they're having their treatment, hopefully at home, so that they're not disconnected from their family and friends, we will be able to look after them properly. So tell me when you want me to stop, because apparently they want me to stop and then, but yeah? Yeah, I can finish. Oh, good. Brilliant. Okay. So for those of you who haven't been, we have a video on our website. One of my dreams in this vision was to have a center, hospital, where patients felt like they were at home. I know it sounds a bit maybe strange, but that they would come and look forward to coming, because I knew that for the time of that journey, they were going to spend quite a lot of time with us. And this journey, as I said, particularly for breast and 1 or 2 cancers, can go on for up to like 9 months or whatever. So we came to it with a lot of color, with light, and a sense of just being at home. In fact, we had a patient at the beginning who she would call a relative or a friend, and she said, for those of you who don't speak Yoruba, sorry, Mo wa lọ́dọ̀ àwọn Odunsi. Because obviously she didn't want to say she was in hospital. But she's saying, at least she's come to visit us in our home. Do you understand? That's what she used to say. She said, Mo wa lọ́dọ̀ àwọn Odunsi, my stay for a few days. I'm going to spend a few days with them. Do you understand? But she felt like she was at home. So that we've managed to, with a lot of, stress, get there. This is what Marcel Ruth looks like from a bird's eye view. We have 3 buildings. Here, outpatients and the day unit and a few wards. That's the radiotherapy center. And in here, we have 2 modular theaters, as well as some more rooms and so on. So it's an end-to-end thing. Patients can have all their treatment, the chemotherapy, the surgery, and the radiotherapy, all in one place, with a lot of color. So Marcel Ruth was the name of my mother-in-law, who unfortunately died of complications of breast cancer. A lady who was absolutely dedicated to Nigeria, although she was English. She came to Nigeria when she was in her 20s to come and teach on her own. We never understood the story. And actually met her husband here in Nigeria. She taught history at Igbobi for many years, Igbobi College, became the deputy headmistress or whatever of Igbobi College, and later on became the first principal of Federal Government Girls College, Ijaniki. So an educationist at heart, a real no-nonsense person. Her favorite color was purple, so our day unit is all purple in her memory. And obviously, the theaters are dedicated to the memory of my father, Professor Emmanuel Elebute, who was, from my point of view, probably one of the most intelligent and yet most humble people that I ever had the pleasure of meeting. So we have our 2 theaters, and we've done all manner of surgery now. So I think on the wards at the moment, I think we have 3 ladies who've had mastectomy, so their breasts removed for breast cancer as the next part of their journey, and so on. We, do colon removal, whatever, all sorts of. This one I'm very proud of because this was our first brain surgery at Marcel Ruth, done using, thank you, endoscopic surgery, so they didn't have to remove the skull to get to that. But that's Dr. Leshi's sort of field, so you have to ask him about that. I don't really know. I just looked down the microscope. But so we managed to do very complicated surgery here in Lagos. Radiotherapy center, and this was quite a difficult machine to bring into the country and to make functional. But we're very happy that we had treated about 1,000 patients or so on the radiotherapy machine to date. We grew very rapidly. And that's why, when you do something and you do it afraid, or you just do it, because if we didn't have any patients, like I said, we had no data. We didn't know whether the patients were where they were, whether they were going to come or anything. But we grew very quickly. And we started with, I think there were 5 members of staff and myself in November 2020. We now have over 70 staff. Thank you. And we're very senior-led. So we're very, we've got 3 or 4 consultants, oncologists, hematologists. It's not a one person with lots of junior people, both on the medical side and on the nursing side and in admin. So our admin staff have over 20 years experience in healthcare in the country, helping us to run the system. Now, we grew in terms of patient numbers very, very quickly, and we're now seeing about 100 new patients every month, which has been quite a challenge for us because, as I said, we had no data, and we did not realize just how many patients we were going to be seeing, but also the complexity of the cases, and also the fact that they're coming from all over the country. So one of the things we hadn't thought about, and we had to think about very quickly, was relatives who are coming from Adamawa and so on. So we quickly partnered with the hotels around us, who now love us dearly, because we opened just as COVID finished. The hotels had been empty, and now they have got patients coming, but from the north of Nigeria or the east or the west. Instead of going to India for 6 or 7 weeks, they're staying in the hotel around the corner for the 6 or 7 weeks. And so I also feel that we're helping to create business in the area. But yeah, so we see about 100, and actually it's interesting because you would think all we do is cancer, but it's not. About 50% of the patients we see from cancer, and we also have a very active health screening service, which we call Concierge Health. Please don't read all this. It's just to illustrate. We've seen more than, I did this, it was in August last year. We've seen almost 3,000 patients now. Breast cancer, common, prostate, just like anywhere else. The long ones that I mentioned. But we also see quite a lot of head and neck cases because they're coming to us because of the radiotherapy machine. So, adult patients from age 18 to 100. The 100-year-old was a king who came with all his entourage. It was quite interesting. We have quite a lot of quite elderly patients, actually, but quite fit elderly patients. The other day, I was walking around, and I was stopped by a gentleman who said, "Oh gosh, I've been wanting to meet you." And I said, "Oh, yeah, well, and asking him about his care." And he said, "No, you don't understand. I've been coming here for almost 2 years, and I've never met you. And I've had the best care. That's why I'm wanting to meet you." Yeah, so, but he was a retired professor of linguistics. And he had been told that he could not have care in Nigeria. He had to go abroad. But somebody then told him about Marcel Ruth. The other thing, actually, I was going to illustrate, because if you look here, we have more female patients. So to the aging female population in the room, including myself, health checks, right? And in comparison, for those who are just coming for their wellness checks, the men are doing as well as the women. So the men seem to be coming for their wellness checks, but the women seem to be the ones. We have more female patients with cancer than our male. We look after children. So when I first came back, I wasn't intending to have a pediatric practice. When somebody referred me the first child, I said, no, actually, we have enough to cope with, I don't think. And she said, "You have to be kidding me. You're the only oncologist that I know that I will send this child to." She was a 5-year-old girl with Down syndrome who had already had heart surgery in India and now had acute lymphoblastic leukemia, which is a leukemia that Down syndrome children can have. So she came to us and we looked after her. But since then, we've had about 80 or so children, about 40 or 50 of whom have had cancer or have cancer. Our youngest cancer patient is 2. We have quite a wide range, and we look after both the leukemias and the lymphomas as well as the solid tumors. We have quite a lot of head and neck cases in terms of children. But again, we've had to adapt. We've had to learn, and we work with a pediatric oncologist who has spent 2 years in South Africa with us. And for me, the fact that these families don't have to travel abroad and can have, look after their family here. I talked about this earlier. We seem to have about 30% of our patients with positive family history. And if you remember the Angelina Jolie slide I was talking about, this is an issue. This is a big issue, and one which we need to address. We do health screening. I don't mind where you do your health screening. Please just have it done. This is not a sales pitch, but we do it, and we do it in a way that is done quite quickly because all our machines and all our equipment is in the same area. And some lady said to me, she said, oh my gosh, compared to when I go to the UK, they'll tell me echo is on level 4, ECG is downstairs, your CT scan is somewhere, then I have to go and pay in the basement. With us, everything is within 5-10 minutes of walking around, and the team are quite good. But we also run a number of awareness days. We've done a few. We've done an annual walk. This awareness day that we did, I was quite proud of because, when you sort of think, oh, we're going to do this, and it was October Breast Cancer Awareness, and we put it out on. We were going to advertise it, and they could book online, and we just thought we'd have maybe 50 people come in and we'd do this thing. When about 12 hours after the thing went online, my marketing guy came to me and said, we have 100 and something people who have already registered. So after, I think about 2 days later, we had to shut the whole thing down because GE had to lend us an ultrasound machine, a second ultrasound machine, because otherwise we would never have been able to do it. So it was great to have people turn up. It allowed me to collect some data, which I'm going to show you here. And what was pleasing was that actually more than 60% of the patients, of ladies coming for the awareness, were in the right age category. They were, 50 and above, which is where they need to be. This thing keeps jumping. What was worrying is on this slide. So we gave them a questionnaire. We asked them a few things. And in particular, there was a question of, when did you have your last ultrasound done if you're below 40, or your last mammogram done if you're above 40? 60% had never, ever. And I told you that the majority of them were above 40. So that's part of this, the message. So, going to the topic I was asked to speak on, a cancer-free body. Is it possible, is what I'm saying here. The limiting factors, of course it's possible, but the limiting factors are age. And we're not going to get away from that. We're all going to grow old, and we're going to grow old gracefully. And even I'm going to have to come to terms with it, because it's going to be great being above 60, granny and everything else. So age, genetics, out of our control. Family history, certainly out of our control. And some of us, it will be the age plus the genetics plus the family history. So think about the additional issues that are going to tip you over into having cancer. But the change at that point is how quickly do you access treatment, and how well the treatment that you access is. And how quickly means you don't sit with that lump or that wound or that whatever for another 6 months. And I'm going to bring the elephant in the room out into the room. So those who have come to see us, and then we don't see them for a bit, and then they come back 6 months later with all their armbands because they've been in church. I'm going to say it because I have to say it. Because for us, there was I was weeping because she could, in fact, she had her chemotherapy. She had an endometrial cancer. She could feel it. So when she had the chemotherapy, because she was responding, she couldn't feel it anymore. But as I said to you, you need the chemo plus the surgery plus the radiotherapy. So she'd had the chemo. She was meant to have the surgery. She decided that, and she went to church and they told her, the fact that you can't feel it anymore means that it's gone. Right? Okay? And she's not the only one. We see this all the time. I'm sure you see it in your practices too. So the ones who go to church, the ones who herbalists, yes, the ones who, hallelujah diet, which is just fruit and vegetables, and all they do is they get really, really skinny, and they become really, really unwell. So there's all sorts, and, with family, saying, yes, it's not your portion. You've got cancer, it can be treated, let's treat this matter, right? Okay? So those are the things that we have to contend with, but I'm hoping that with time, will not be. So back to, if you didn't hear it before, your health screening, okay? Just do it. Whether it's your birthday present to yourself, whether it's your Christmas present to yourself, please just do it. And especially the older you are, and you can see the women seem to be on the not so lucky side at the moment. I don't know whether that's just us at Marcel Ruth, but there are a number of reasons why we should just get these health checks done, and then maybe we'll be sticking to not having, a cancer-free body. Thank you very much for listening.
Thank you very much, Dr. Elebute. We'll be taking questions for about, we'll have the interactive session for about 10 minutes. If you have questions, please. We have Dr. Shea and a few of members of our team who will go around to pass the microphone. Please, if you have questions, kindly indicate and we'll be able to take your questions. Thank you.
Thank you very, very much for that comprehensive, eloquent, and just wonderful listening to you. I'm Annetta Kinshete, Dr. Annetta Kinshete.
I thought I knew you.
I know you. We haven't met one-on-one, but we've been on panels together.
Totally.
Virtual panels.
Well done for all the work you're doing in the field of sickle cell. Well done.
Thank you.
Well done. Well done.
That's the gift of COVID. So we're able to bring the whole world together in one room, and that's how we met. But so thank you so much. Thank you so, so much. I won't want to say everything that I have in mind because I have a lot to talk about. However, very quickly, you spoke about data. You spoke about data and cancer registries. I worked in the Ministry of Health. I was director in the Ministry of Health for many years before I went to America. However, I feel that behoves us not everybody, all Nigerians, because we're government. As a matter of fact, I speak to anyone who cares to listen. I teach medical students now, and I think that there are gaps, and I feel that there are things we need to let them know that they can grow up with and give us, bequeath a better Nigeria to other generations, including the art of negotiating and the art of lobbying, because that's the way of the world. And we doctors are famous for not being good negotiators or good lobbyists or good managers, but we're learning more and more. But I think I digress. The issue of data, cancer registries in the Ministry of Health is domiciled, today is domiciled in the Public Health Department. Tomorrow is domiciled in Hospital Services Department. So there's no coherence. And that's why you're having that problem. So I think it's for you and everyone working in this cancer space to reach out, to engage with government, because we're talking about public-private partnership, and that's one area that we can really benefit. For us to get those data, because it's not just for you, it's for all of Nigeria. But if you use the data, you're going to do a lot with it. Yeah. But you cannot access the data alone. So please reach out to government, the ministers, permanent secretaries, whatever they are, directors, they are there for us. They are servants of us. We put them there, our taxpayers' money. So they shouldn't lock the door against us. So reach out to them, please, through your staff, through your whatever entities, reach out to them and ensure that we have a functional cancer registry, because that will help us where we're on this journey for cancer management, care, and control over time. You're doing wonderfully well, which is fantastic. What you are doing in Marcel Ruth, it's reverberating everywhere in the world. Thank you for what you do, as far as that is concerned. Then for the rest of us, wherever we work, this business of awareness is everybody's business. So wherever you work, in your little clinic, in your various endeavors, don't miss the opportunities. We call them mixed opportunities in public health. I'm a public health physician. So anybody you are seeing, anybody who walks into your office to see you that engage with, do not miss that opportunity. Talk about cancer. Talk about prevention of cancer. Talk about knowing your numbers. That awareness thing. And try and follow up as many people as possible. And you don't have to have an NGO to raise awareness. Do your bit in your little space, in your little corner. I'm telling this to all of us, wherever we work. Thank you very much for what you do.
Thank you. Yeah, thank you. I'll tell you I'm not a lobbyist, in fact, actually, because I think I'm too direct, but I did try. I went to Abuja, and I went to the Ministry of Health. When I got there, just a funny story, the lift wasn't working, and the cancer registry was on the 6th floor. So I thought, well, I've come all the way. I mean, I went to do a few other things, but I'm so passionate about this data thing, and I've made this appointment with this man. I climbed the 6 stairs, and when I got up there, he said, oh, yes, we have the registry. I said, okay. How long? He said, we've been doing it for 5 years. I said, so the data, because we're already collecting. Anyway, that's where the story ended. So we're collecting our data. We're going to have single center data, which we're hoping to present at 1 or 2 meetings later on in the year. And I'm going to use that to go back, because I agree with you, because we've got to do it together. But we've also got to do it in a way that is clear, that it's accurate. Because poorly collected data is no data at all. So, yeah. But I agree with you. We have to do more. Thank you.
Thank you very much. My name is Shobo. I'm a priest. From your presentation, I just want to ask, because my mother died of breast cancer, so I know that we need to do a lot of, but how can you partner with clergymen who deceive? I'm a priest, I'm saying that. I'm a venerable in the Anglican Church. So, who deceive, manipulate, indoctrinate their congregation into seeking, quote and unquote, church healing for cancer, knowing fully well that, sorry, it doesn't work that way. I said my mother died of breast cancer. And part of the reason why she died was looking for pastor's healing. Quote and unquote, pastor's healing. She died at 55. She will have been 82 or so now, but she died early because she went looking for miracle healing. I, for one, have been at this in my own little way, as at last Sunday I was still talking about it in church, paying for people to go for tests. Because I told them I don't want to bury anybody who died, because if you die stupidly, you commit suicide. I always tell them, if you die of preventable, because
from what you said that I know of, early detection is the best healing. But if you don't detect, Jesus will slap you when you get there. Don't call Jesus into what is not his business. He has given you everything you need. People like you are doing a human's job. I knew when your father was my friend. So, how can you partner with those so-called pastors, priests, bishops, GOs, or whatever name we call ourselves, that are in the business of manipulating the mindset of people to go and be sleeping inside the church, instead of going to people like you to cure them? Thank you.
That's, I have to say, I'm really, really grateful to you for making that comment. And I was just thinking, so next time I start saying what I say, I won't apologize anymore for saying I'm bringing the elephant out of the room. Because, and honestly, I think those people who are in the business of telling the patients to come to them, because obviously it's all financial, right? And it's the churches, but it's also it's not traditional medicine, because a few of these clinics are in Lekki and so on that are doing this Hallelujah diet. The Hallelujah diet, they go and stay there, and they're for like 2 months or whatever, and actually they only feed them vegetables and fruit. What a business. Because if you collect money from a patient, right, and I think they're paying like 2 million or something like that, how much is the vegetable and fruit going to cost the person who's providing the vegetable and fruit? The profit margin is huge, right? And these people become really unwell. I think, education and awareness is key, is really key. The other thing I will say, though, I do feel that sometimes some of it is to do with the difficulty in accessing treatment, because of how expensive it is. And it's expensive everywhere. Because people always say to me, oh my gosh, you must be so expensive. I'm like, of course, it's a radiotherapy machine and so on. But apart from that, even a cancer treatment in Lasut or wherever is expensive. Because the patients who go to those places in the socio-economic group, they can't afford. And there's data from 2 studies that have been done. I think one from Isaac Alatishi's group in Ife, looking at pediatric oncology treatments in Nigeria. And this is in Ife. It costs 6 million naira on average for this, because ALL, acute lymphoblastic treatment, lymphoma treatment, goes on for almost 2 years with maintenance, okay? So it's expensive. And also, we don't only get patients who can afford to pay. One thing about us as a people is that we're very generous, we're very supportive. So a lot of our patients come, and actually they're being sponsored by somebody. A lot of our patients, it's not because they can walk in and pay by themselves, but somebody is paying for them. But yes, but because we don't have a government system where somebody can go in and have their treatments, that is part of the reason why they're left to the, this alternative routes. Because honestly, if they did have the opportunity to go and just have their treatment done where they can afford it and where it's near to home, I think also that would be, but I'm not going to go and face any, I think it will be left to you to face your colleagues and do I'll go to, Dr. Akishete has sent me to the ministers and lobbyists. You're going to go and help us with the... Yeah, okay. Yeah, yes. I think she needs a microscope. Microscope, can you imagine? Microphone. Me and my microscopes.
I have the microphone now.
Okay.
Thank you very much for this education and enlightenment. Standing before you, or with you here, I've lost 5 people to breast cancer.
I told you my data was right.
And I'm a clergyman also. Reverend Canon Aki Akere is my name. The last one, with the very, very painful happened April 11th this year. She was 77. I'm saying this now because of what you taught us this afternoon or this morning, that we can combine those things, those treatment, those things. So we combined, at least from that your diagram, actually the spiritual one which he taught about was not there, but we included it. And so the combination from what I'm saying now, actually the combination works very well. But one thing about the combination, is that they are very, very expensive. Absolutely, very, very expensive. So going to the spiritual one, which is rather free, that makes it, so it is not stupid. It is not stupid. Again, because it comes on faith, our belief, and we have right. I think we have right. Well, reading the scriptures, reading how Jesus Christ cured, and we can still stand upon that. Standing upon that faith and standing upon the promises. The power of Jesus Christ curing. And actually, I think in the medical field, they say, God's cure, they only cure. So the cure can still come from spiritual view. So what I'm actually taking away from here now, because I want everybody actually to take it, is that the early detection, the early something, and attacking it early from what you have told us about Reverend Bruce now, it is, well, we discover it early and then we treat it early and then we make to the combining any of those methods. Thank you very much. Please let us get on with this awareness from here and speak very well of it. Please, divine healing is not stupid.
Thank you, sir. I don't think we were saying it was, because you have said it in a different way, and what we say to our patients, because like I even said at the beginning of this, even becoming Marcel Ruth is divine, right? You know, actually, if you know the number of people who said to us, this will not happen, Nigeria is too difficult, and so on. So it's all, but doing it together is what matters, sir. It's when people go off and just go with the praying without having the medicine and the other treatments, then we have a problem. If that makes sense, yes. Yes.
Very quickly.
Yes.
Excuse me, very quickly, please. I would like to take Dr. Obama from Zoom. Can you please go ahead?
Oh, okay. You've got two ladies there. Dr. Karen Lee and there's a lady in front. Do you want me to go on? There's a lady in the front here. There's a lady in the front here.
Hello.
Her hand has been up.
Please go ahead then.
Yes.
Good afternoon. How are you?
Okay.
My name is Bukola Olagbaju. I'm very glad that I am opportuned to be here today because I've been greatly enlightened, I've been greatly informed. I also had the privilege of meeting your parents because my father passed on in his hospital, but I can attest that he got the best medical care. It just happened at that time. My elder brother is also a consultant surgeon in Birmingham. I think he's colleagues with Dr. Leshi Funsho-Adedeji. And why I'm up to talk is that I was supposed to have done, I think it's endoscopy, if I'm correct,
yes,
some years back. And I have issue with having confidence where I need to do the operation. I have shopped maybe I can use that word, for hospitals. So, in fact, I had made payment somewhere and, went in for headaches and all that just to get my money back because I wasn't confident. I want to find out, do you carry out this operation in your hospital? That is one. I also would like to find out if you have associations as well with insurance firms, because I've just checked my insurance and I can't find your name there. So those are the questions I'd like to find out.
Thank you very much, and thank you for the compliment about my parents. Endoscopy, colonoscopy is probably what you mean, the one from the bottom. But yes, yeah. It's done in a number of places. It's not an operation, it's a procedure, okay? It's not a big deal. It's not a big deal. I can tell you that for nothing. It's not a big deal, all right? What is a big deal is not having it done and then ending up, especially the older we are, with a problem that could have been picked up that's not picked up. So yes, we do colonoscopies. Yes, we partner with HMOs. Yes, yes. I don't know what to say on that matter, but as they're about to launch the National Health Insurance, right? I think even the HMOs are struggling at the moment because they're meant to become part of this National Health Insurance scheme that is insuring lives for 30,000 naira or 50,000 naira. I'm not sure where we're going to go, but I gather that, by having the volumes of people, we'll be able to fund Nigeria's healthcare service. But I'm sure in the way I'm speaking, you can see that I'm not necessarily convinced.
So,
I was put off meals maybe from about 6 p.m.
Absolutely. Yes. There's only one guideline. Yeah.
From about 6 p.m., I think till about 10 or so, and I went for the procedure in the morning. But in Nigeria, in the hospital I went to, the man said I was going to go off food for 5 days.
That's not possible.
And I was wondering.
No, that's not possible.
So
that
is why
no, that's not possible. There are many, there's many reputable hospitals, including Marcel Rose, of course, but we will not starve you for 5 days so that you have a colonoscopy. There's a lady in front here who's been trying to speak.
Just a minute, please. Dr. Obomanu was about to speak earlier. Right. Please go ahead, sir.
Oh.
Good afternoon. I don't know if you can hear me.
We can hear you, yes.
Okay, good afternoon, and thank you so much for such a brilliant lecture. I won't take your time, and I don't want to go on and on about how informative this is. Well, I will just go straight to the question. So I already typed it, and I'm looking at the environmental factors you did mention, and I'm wondering, we do have issues of organic versus genetically modified products here, chemicals used to ripen fruits and additives here and there. And I'm not saying these are the only things to worry about, but I'm just wondering, is there any thought at all behind maybe also reaching out to people that are responsible for legislature to see how they can also help us in this little space, but maybe significant too, in causation of cancer? And yes, like Dr. Akinchete said earlier, there are so many things you have stimulated in your brilliant presentation that there's so much to talk about. So I will just stop here. There's just quite a bit. So thank you so much. Quite a brilliant lecture, and I don't mind if the recording comes out at some point. I would like to listen to it again. Yeah. So thank you. Bye.
Thank you very much. Thank you. Thank you. Yeah, I think when it comes to food, actually, when we first set up, I met a few people who had farms. There are quite a lot of people with organic farms across Nigeria. I don't know whether you're aware. And some of them are so passionate about the organic foods that they will not touch or eat or whatever, anything else. There's also discussions about sugar and whether sugar, because cancer cells can, thrive on sugar and so on. But I think that with everything, it's about moderation. Living a life where you can only, if you just have only organic food, it's going to be expensive anyway, I think it's about having high fiber in your diet, that's for sure. More fruits, more vegetables, that's for sure. And I think even in the UK, I don't know the US so much, there is not so much about the risk of cancer from food that you must go organic. It's more a lifestyle choice. But I think anything in moderation is about moderation, really, from my perspective. But there's a lady there, the lady in the glasses.
Thank you very much. My name is Olugbemiga Omolayole. I'm Dr. Iyabo Shadari's first cousin. Okay. I just want to collaborate on, what you just said, because my mom is a cancer survivor. Mm-hmm. She's 94. I just want to feel that probably she was diagnosed early, enough, because I still have that memory in my head. My mom and Iyabo's dad are siblings. Iyabo's dad is my mom's immediate younger brother. So he came in that day, and my mom was like, because they are very close, just like 5 and 6. So my mom was like, Wale, I'm having, I'm feeling, a node, on my left breast. They both went inside, and next thing, my grandfather, was informed. And later on, my mom said, I don't want to be a guinea pig at UCH or at Luth. So a few weeks after, my late uncle, and my mom, they both went to Ireland in Dundee. And that was 79. I was writing my, exams, then. And she was away for 9 months. And ever since she came back, she didn't go back for any treatments. She's still very much alive. So, few years ago, when Iyabo came down, with us, we are both hoping that, my mom is still alive. You're going to make it, you're going to come through. But I just want to feel that she was not diagnosed, early enough. And Iyabo will be the one, because I'm an only child, so I'm really, really close to her. My relationship with her is more of sibling than, first cousin. All our friends here, can testify. So every year, she will ensure that I go for, mammograph. Sometimes I'll tell her, hey, your wala is too much. Please, 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 let me be. There was a particular day, she actually went to pay. I refused to go. She came to my house and, took me, down there. Well, some few years ago, I discovered a lump as well. I got it off, and I've been doing all my, tests and everything, and I'm okay.
Thank you so much, because that could not have been an easy testimony to give. Thank you so, so very much. It's really, but I think, thank you, because you've given the positive testimony about a long-term survival, which people that don't seem to know about or talk about. And I think those testimonies are needed for people to understand. The other thing about, obviously I don't have the details about Dr. Shofoluwa Shadari's condition, but I will also say that, there are different types of breast cancer. There are different types of, the type of cell that the cancer comes from. And for example, if it's squamous, it tends to be more aggressive than it's adeno, and so on. We know about immunohistochemistry, and if the receptors are negative, triple negative breast cancer is more aggressive than the ones that are positive. So there's a number of biological things that would make it, can make it more difficult for people to respond to treatment or survive, apart from whether they present early or not. But I feel you, and I'm glad that you have continued to have your checks. And it made me just realize that I've made a massive, where's the young man who said he failed his test earlier on today? I just realized that I've almost failed mine. So for those, where there's a family history of cancer, okay, when we say that your health check starts at age 40, right? Actually, in the US, they've just changed the GI guidelines, gastrointestinal, in black people to 35 because of the young man in Black Panther who died. Forgotten his name now. Thank you. Chadwick, yes, exactly. So they've actually changed the guidelines. So the colonoscopies and everything are starting from 35 because he was quite early and he wasn't picked up. So that's the one thing. But for those who have any cancer in the family, so for example, I don't know, your mother, maybe she was 40 or something when she was diagnosed. She was 50, so that's still 40. But where we have even younger people with cancer in the family, the screening for those family members should start 10 years before the person, so let me say it simply. If somebody in the family was diagnosed with breast cancer at 35, all our sisters, nieces, and nephews, and blah, blah, from 25 should be having screening. Because that's the one thing we don't talk about. So those guidelines are guidelines, but once you have a family history, the age at which, so I presume you're her daughter, right? So you should be having screening, So the age goes 10 years before when they were diagnosed is when, and also the screening is not because, she had breast cancer, so all the women should be checked. Everybody, even the brothers, is not about that cancer alone, it's just about cancer generally, because I've told you about the gene. So that BRCA gene is not just for breast cancer. In the beginning, they thought it was, and that's why they named it breast cancer, whatever. But actually, it's also, there's an increased prostate cancers in men that have the BRCA gene, and so on and so forth. So I hope that message is clear now. For those who have a family history, 10 years before the first person, the age that person was diagnosed, is when the screening should start for those family members. All right?
Thank you very much.
Yeah.
So because of our time, we are only able to take 2 questions.
Dr. Karen Ruby is standing, and she's got the microphone in her hand.
Yeah, thank you very much indeed. That was a really interesting lecture.
Thank you.
My husband said, don't forget to tell her how interesting it was. Yeah, I'm sure you know that we're fans.
And you know that I'm even a bigger fan. You know that, right? I'm a much bigger fan from way back when.
Thank you for the lecture. Thank you for coming back to Nigeria and making this available to us here. Yeah. At least giving us that option here at home where there's support and all that. You've answered my question in a way, because I was going to ask about sugar.
Yes.
I've heard a lot about sugar, like if you starve the cancer of sugar, it could just shrivel up and, disappear.
The answer is no.
No, okay.
No. And no, but let me explain to you where
but I just want to finish.
Go. Sorry. Yeah.
So I thought, okay, she's answered my question, but I still want to tell you this.
Yes.
I didn't hear much about your mom today. She was my lecturer.
Yes.
And just the way you deliver, the way you stand there, the excitement, the communication, it's like I'm watching her lecture me. It's just amazing. That you got from her, for sure. For sure.
And that's Professor Leshy, right?
Yeah.
I rest my case.
So, yeah. So, I just thank God for your parents as well. They've been a blessing to us. Yeah.
Thank you. Thank you so much. Yeah. No,
and the final question, sir?
No, can I just quickly, I'm just going to respond to the sugar bit. So the reason why this sugar thing has become an issue is that I'm sure some of you have heard of a PET CT scan. Yeah, PET scan, okay. So not the ordinary CT, but something called PET CT, which has revolutionized how we look after cancer patients. Because in the past, we'd give the chemotherapy, radiotherapy, and so on and so forth, and sometimes there might be a little bit left, something, maybe it was this big before, but it's now this tiny. We were never sure whether this still has cancer cells in it or not. So we just continue to treat and continue to treat. And of course, you get to a point where the toxicity of the drugs outweigh the response you're getting. And then PET came. And the way PETs work is that they are delivering a radioisotope that's labeled with some sugar, type of sugar molecule, not sugar, an FDG. And then when it lights up, you know that it's still cancer. But because this molecule that's attached to the radioisotope is a sugar type of molecule, then came all this whole conversation about, okay, that means that the sugar, the cells like sugar, thrive on sugar, grow on sugar, but it's actually from a diagnostic setting that this thing came, not because we can see. And of course, since then, some clever scientists have fed rats and mice sugar and said, yes, it lights up and so on and so forth. But on the other side, if you look at, and for the public health people, you'll have to do big studies where people do no sugar at all, maybe some sugar and lots of sugar, and see whether that changes their outcome, right? Because that's what you're looking for. Is it in this group, because they're eating sugar, their cancer doesn't go away? We know that the response to treatment is multifactorial. I've just talked about the biology of the disease before you even get to sugar. The receptors on the surfaces of some of these cells, the genetics that the person has, and so on. So, of course, if I have a patient who decides that they're no longer going to have sugar during their treatment, actually, that's not a bad lifestyle to have, right? What I have an issue with is those who completely, this hallelujah diet, where, totally change diets to where, that can be a problem. But that's where it came from. That's where it came from. And thank you. I will tell my mom that you asked after her. I mean, like for years, I used to think, I can't look like her that much. Until one day, I'll never forget, I came to Lagos and I went to, what's the name of the bookshop that was in Falomo? Quintessence. I went to go and buy something in Quintessence, and then I was paying, and this person came behind me and said, "Ma, I haven't seen you for such a long time. You lectured me in school." And I think he was trying to work out the age or something, but I'll pay for your books and everything. And he said, "Oh, no, you're not Professor Mrs. Elebute. Do you know her? Are you related to her?" I almost said no, but I thought, you can't lie like this. So this was somebody I've never met in my life, who was not even, so I must look like her, but, there you go. And act like her, yes. Yeah. What is it? Yeah.
So thank you very much. It's been an interesting, how do I call it? Should I say lecture, but very engaging. I think somehow all of us have experienced cancer, yes. And I think I felt more comfortable with the concept. Lost my mother in 2019, lost my mother-in-law in 2019. We spent a lot in UK, India. But why I stood up is I wanted to maybe, from the perspective of a commercial institution, I think there's a lot we can do together. Currently, in Access Bank, we fund people who want to do IVF. Okay. And for the fact that we fund people who want to do IVF, I'm just thinking when you say patients come in, they can't seem to be able to afford the treatments immediately. There's some things we can do. Yeah. So I think the IVF was born out of a need where we saw, I think we've celebrated about 80 babies now from the concept. So, and these are people that are fund. So we could also explore that same partnership with you and see how much we can do together. So that's what I wanted to say. Thank you.
Okay. Can I say thank you very, very much? But can I also say, you bankers, when we now start trying to sort out the nitty-gritty, because we had a bank that came to us, and then in the end, they said the patient, true story, has to have a family member that's going to sign that should they die before that loan, it was even a loan, is paid off, it will be the family member's responsibility to pay the loan. It died. You know, do you understand what I'm trying to say? Because you cannot, you know, because also the message even to the patient is that you are going to die, right? That's the message, which is what I was trying to explain to them, that just by putting that in writing means that you believe the patient is not going to survive, and then you're telling them that, and you're going to be a burden to your relatives. And this matter took us 6 months or so with this bank in particular. I'm not joking. But so women with breast cancer, 6 months we were discussing it up and down. And on that one, whatever, they will not shift. And that was it. Nobody would ever sign, none of the patients would ever sign to it. But you know something, I'm sure you're going to do better. So we can have... Yes. No, 100%. Honestly, it's the right time. I sort of slightly jest, and I shouldn't have made fun of you like that, actually. I should just have said thank you very much. That's what my mother would expect, so thank you very much.
All right.
Yes. Okay.
All right,
is
so,
that it? Okay.
Good afternoon, everyone. My name is Adeola Folivi, and I'm a management consultant by profession. Now, I just thank you very much again, like everyone says, fantastic lecture. I learned quite a bit, and I'm glad I came. I nearly didn't come, because I had an appointment, but I'm glad I came. So thank you. Well, just to say that we have one thing in common. I'll be 60 next year as well. And I have a problem with that. And I'm struggling to accept that. But seriously, I think my question is this. I also have dealt with relatives and friends who have had cancer.
Yeah.
Some have survived, some have not. My father had prostate cancer, and he passed on in the process, I think, some 15 years ago. So the truth is, not everyone survives. No. That's the truth of the matter. Now, there's been a lot of talk here, or a lot of suggestions about alternative therapies. So I'm just wondering, because some people turn to alternative therapies because perhaps they're not getting better, you know, with the orthodox systems as we know it. So sometimes they're pushed to turn to spiritual solutions or alternative solutions because something's not working out for them. So I'm just wondering if we shouldn't really be looking a little closer at alternative therapies, because some people have sworn that these things have worked, you know, for them when other therapies have not worked. And perhaps should you not be partnering with some alternative providers? Exactly. Perhaps that patient needs something a little more, you know, than what we know, you know, at the moment. Thank you.
Yes, thank you. Thank you very much. And honestly, I think it's a subject that we can debate for hours and hours on end. From my experience, okay, both being in the UK for over, I don't know how many years, and I had quite a number of Nigerian patients, as you can imagine, and even being back. So does anybody know about soursop here? So every patient is on soursop because somebody has said that soursop cures cancer. So I go to the ward round, and when they say, I said, so have you had your soursop today? They were like, you can have your soursop. You just have your chemotherapy as well. You can pray to God, but you do the other treatments as well. That's all I'm saying. Talking about partnering, and people have done research with, especially in India, because you can imagine India is a bedrock of alternative treatments and herbal medicines and so on. I think we have a fundamental difference, and it's not about saying we shouldn't, because in medicine, to get any drug or any treatment to a patient, the amount of research and data that you have to provide, right, and real data, and you know, I've been involved in a drug that came to market. You start with a small number. After they've done it in animal studies, then a small number. You have to be able to publish them in big journals. Then you go to multi-center studies. You're going to be audited by the FDA in America and the EMEA and this and that. You know, it's a lot of rigorous work that goes into it. And then, for example, I'll tell you, somebody came to me about CBD, the cannabis oil, and how this might be a good whatever. So I thought, okay, let's have this conversation, maybe even for pain, even if that's what it is. So what's the dose, and where do you get the guidelines of what the dose should be? So that's, I think, you know, when we're thinking, yes, that I think that's part of the issue. But it's not that it doesn't, you know, we shouldn't try and do it. I agree with you. But I think for the audience here in Nigeria, in Africa, I think what we're trying to say is we don't want to be seeing patients with advanced cancer where we can't do anything anymore because they've gone to sit in church or somewhere, hallelujah diet or something for months after they knew that they had a problem. Because some of them will come, they'll have the scans, we'll have a diagnosis, we'll sit down with them, their family members, everything, and then they disappear. And, you know, so that's, I think, what we're trying to say. But otherwise, I don't think there's a problem, really. Yeah? Okay, thank you. I think that's, thank you very much.
Please, a wonderful round of applause for Dr. Elebute. I can take that. I can take that.
Thank you.
Thank you very much, ma'am. Can we please continue to give her a round of applause till she gets to her seat? It's indeed been a wonderful session that we've had from contributions of everybody. I personally enjoyed it. So I want to thank Dr. Elebute for the time that she put into putting together the presentation, and to everyone who also participated. Thank you very much. We're gradually coming to the end of the lecture. We would like to please welcome Mrs. Adekwetu. Ms. Adekwetu serves on the board and for a few words. Welcome, ma'am.
Thank you. Good afternoon, distinguished ladies and gentlemen. Thank you so much for coming and staying for the lecture. I must confess, Dr. Elebute Odunsi, this is the first time I've actually sat down to listen to a cancer lecture, and I can tell you it's been very enlightening, very interactive, and extremely informative. Thank you so much. And thank you for making time in your schedule, because I know we had to move things around for you to be here today. Thank you so much. And well, the reason why we are here is to celebrate 20 years of SS Dental. And suffice it to say, as you have said, you do see a lot of head and mouth and all sorts of cancers. So SS Dental, as you well know, and as we've been told, is still a standard of excellence. And so would like you to also come for screening. It's part of the screenings you should come for, so that you make sure that you don't have any of the elements of any of the head ulcers. Cancers, as it were. I'd like to thank, well, the chairperson has left, but I'd also like to thank her for coming, and she gave quite an enlightening speech. And most of all, there's somebody that I will call an angel that the Lord sent to us, and that's in the person of Mr. Clinton Peters. Sir, Modukwe, sir, thank you very much. On behalf of the board, Mr. Peters is a family friend of Iyabo's. I got to know him through his late wife. His late wife and Iyabo were quite close, and Iyabo introduced us years back, and we had, we shared, we had shops in the same complex. But Mr. Peters took this 20th anniversary upon himself. He gave us all the counsel, the guidance, the direction, used his personal connections to make this happen. Please, can we give him a rousing applause? Thank you, sir. You are a father, you are a friend in a million, and in Yoruba, permits me, I become more Yoruba. Dupe, you're not the only one that thinks about that age. I'm over 62. I will not say the exact age. And I become more Yoruba as I've aged. And I will say, sir, I'd like to thank the board. And the board consists of our chairman, who I'm sure is on Zoom, Mr. Femi Oyedipe, and the silent partner of SS Dental, Dr. Graham Shofoluwe, whom I must tell you, we have turned him from a conservative UK GP, we have turned him by force, by fire, to an entrepreneur and part owner. Now he's no more the silent partner. He has become active, so he now knows about business and dental practice. And Bolaji Shadare, Eniola Shonuga, Iyabo's daughters, who are also on the board. And of course, I want to thank the management and staff of SS Dental. You have been wonderful. Can you all stand up together at the back? Just stand up. You have been wonderful. Please come together so we can see your faces. Some have been working there for over 10 years, some up to 15 years. But I want to say this, I want to commend you for your dedication, for your loyalty, for everything you've done to keep the flag flying. Even when Iyabo was going through her treatment and she was in and out of the country, you were there. Your loyalty never, ever wavered. And you've kept the standards. Some have gone and come back. I won't mention names. And some doctors that have even gone for masters, when they came back on holidays, they still came to see their patients. It's like, I won't call you management and staff. I will call you the SS Dental family. Because I have also made myself, I'm one of you, I've also made myself part of the family as well. Of special mention, please, okay, you may sit down. Thank you very much. Of special mention is Mrs. Yetunde Modinot Oladejo. Please, stand up. I'll tell you something. Mrs. Oladejo, she's not a full-time, she's a consultant. She came in as COO. She first came in as a consultant, then as COO to Iyabo, and then, during the time of treatment, she was running the clinic. But I can tell you that she has taken full ownership, as if the clinic is hers. She has taken the vision and she has run with it. She has gone the extra mile in every aspect. Yetunde, I don't want to get emotional today. This is not the time for emotions. This is time to be strong. But I must tell you, Oshoju Oshein, the Lord will repay you. The Lord will lift you up. He will grant you your heart's desires in everything. She has given of herself, of her time, of her resources. Whatever she's being paid from SS Dental, it's a pittance compared to what she has put in. And Graham and I, we always thank her. We are very grateful. And she has taken, before she passed, she had taken Iyabo as her sister, and Iyabo too had behaved as her sister, and she has kept the flag flying. Thank you so much for being there. I know it's been a strain, and I know you've been overwhelmed in the last 2 weeks, but see what has happened, and it's a testimony to you and to the rest of the team. Ladies and gentlemen, friends of the family, friends of the SS Dental family, friends of Iyabo, family, Iyabo's cousins, at least 2 of them are here. Some others were invited. I don't know whether they came or whether they are on Zoom. Some friends are on Zoom, and some clients are on Zoom. The patients of SS Dental. Without the patients, we will not be in existence. And on behalf of the board and of the management of the company, I'd like to thank you all very much and to express our profound gratitude to all of you, because everybody in this room has played one part or the other, either as a patient or as a friend, and has supported this vision. And it's a huge testimony that 2 years on, more than 2 years on, that the legacy still lives. Ibadan, at first, were like this, Ibadan. But guess what? Iyabo had paid the rent of Ibadan before she passed. When she came for her doctor's engagement, she actually went with, I think, Bolaji, you went with her to see, Eniola went with her, to see the space herself. She had paid for it. She had committed in December of 2020. Am I correct? And so we had no choice but to carry on, because when someone has done that, you have to, like obey. And we did. Obey, we did. And there's another dedicated team in Ibadan, and they've done very well. So thank you, everyone. Thank you for being here. Thank you for celebrating with us. May the sound of celebration continue to reverberate in all our lives in the mighty name of Jesus. Thank you so much for coming.
Please, another round of applause for Mrs. Adekotu. So we've finally come to the end of our session today. To bring the session to a close, we would invite Dr. Sheye to say the closing prayer. Dr. Sheye, we await you. After Dr. Sheye's prayers, we can please enjoy the breakfast that has been provided for us at the back. And we can also wait for photos. Dr. Sheye, please let us have you. I think Dr. Sheye is engaged. Dr. Dami, can we have you say the closing prayer, please?
Please shall we rise to our feet. Thank you. We are glad to have every one of you here. Let's close our eyes. Our Father and our God, we thank you for this successful remark of this anniversary. Thank you because you started with us and you ended this program with us. May your name alone be glorified in the name of Jesus. I pray for everyone affiliated with SS Dental. As you've come to celebrate us, I decree into your life, may you be celebrated in the name of Jesus. In everything that has to do with you, celebration will never cease. In the name of Jesus, the Lord go with you as you depart from here in the name of Jesus, and you get back home safely. Thank you, Father. In Jesus' mighty name we have prayed. And everybody say loud, amen. Amen. Thank you.
Please, members of the high table, you want to please wait behind for photo sessions.